first attempt and became board certified in diagnostic radiology in '82.
After becoming board certified, did you do any additional training in
I-
radiology?
I did. I stayed on at Northwestern University for an additional year to do what's called a fellowship. And a fellowship is an additional year of focused training. Following completing the fellowship, it qualified me to be able to take an additional board exam, this time in nuclear medicine or nuclear radiology, which has to do with using radioisotopes to image the human body, such as a bone scan, looking for metastatic disease or a kidney scan, liver scan, brain scan. And I took both of those tests, written and oral, passed both of those on my first attempt, and became board certified in nuclear radiology in 1983.
Now that's 2 boards. After that, did you continue your education and training?
Well, at that point, I did go out into practice. But while I was out in practice in 1996, the American Board of Radiology offered for the first time a separate board in interventional radiology. And interventional radiology is the minimally invasive aspect of radiology. So in other words, doing things with needles, guide wire, catheter, and bringing those things into the body and being able to carry out a therapy. So as an example, an angiogram and angioplasty, putting a stent in an artery, whether it's a carotid artery or a kidney artery, running a microcatheter up into the brain to dissolve a clot before the person gets a full-blown stroke, or to coil an aneurysm in the brain so that the person doesn't need to get their skull cut open and the aneurysm clipped. So I had been trained in interventional techniques at Northwestern University, but there was never a separate board for that. So once that became available, I decided to go ahead and take that test, and I passed that on my first attempt as well. So at that point, I had achieved 3 separate boards in radiology: diagnostic radiology, the nuclear radiology, and the interventional radiology.
Is that rare in your field?
It is. Most people seek to get board certified, but usually you don't see very many people with 3 separate boards.
Let's talk a little bit about your work history and the positions you've held. I know you spoke about being here in Dade City. Talk to me a little bit about your work history, the different positions you've held.
Okay, so when I left Northwestern after my fellowship in '83, I moved down to Tampa, Florida. I joined a relatively large radiology group in the Tampa area. I think I was the number 15th member in the group. That ultimately, over 20 years, grew to be one of the largest radiology groups in the state of Florida, with 55 men and women radiologists. I was on staff at 7 different hospitals throughout the Bay Area, on staff as a radiologist at Manatee Memorial Hospital in Bradenton, at the Brandon Regional Medical Center, at University Community Hospital, which is now called Florida Hospital University, Community Hospital Carewood, St. Joseph Women's Hospital, Dade City Hospital, and Newport Richey Hospital. Early in my career, I became assistant chairman of radiology at the Manatee Memorial Hospital in Bradenton. Then later, I was elected chairman of radiology at Dade City Hospital, right up here in the Dade City area. Served as chairman of that hospital for multiple years. Then following that, I was elected chairman of radiology at Brandon Regional Medical Center, where I served for about 10 years as chairman and also sat on the executive committee at that hospital for about 10 years.
Now, have you served on any committees or had any leadership roles in various medical organizations?
I have. I've sat on some national committees. One of them is called the Society of Interventional Radiology, and I was on that committee for several years. I have worked locally, I'm on the editorial board of Hillsborough County Medical Association Journal. I've also served as president of the Florida West Coast Radiology Society, which is a membership of radiologists up and down the west coast of Florida, wrapping around from the Panhandle all the way up to Miami. And this is an organization where we use the dues that we collect from radiologists to fly in experts from around the country to give us a lecture. And then we can sit with them after the lecture and compare how they're doing things at the Mayo Clinic or Mass General or UC San Francisco compared to what we're doing at our hospitals in the Tampa Bay area.
What's the American College of Radiology?
So the American College of Radiology is an organization that oversees all radiologists throughout the United States. And most radiologists do belong to the American College of Radiology.
Now, I understand that you are a fellow of the American College of Radiology. Is that true?
That is true.
What is that?
So a fellow is one of the highest levels that you can achieve in the American College of Radiology. Basically, one will need to be nominated and elected as a fellow, and it's based on your contributions to radiology, leadership roles in radiology, or publications and teaching in radiology. So I was very honored to be elected to that position. It allows one, besides writing your name, Michael J. Foley, MD, you get to put FACR at the end of your name as well, which stands for Fellow of the American College of Radiology. And even though most people don't know what that means, people in medicine do know what that means.
Now, have you published any articles or participated in presenting any scientific courses or seminars in your specialty?
I have. I think I've got 34 publications right now, and many of the publications have to do with trauma radiology. And some of the first articles that I wrote, in fact, were due to spine trauma and brain trauma. Another area of interest of mine has been MI or breast cancer, and I've written a few articles on that as well.
Now, you've talked about being a member of a big imaging center. Whatever happened to that particular imaging center?
Well, I think I took you through the hospital years. So I worked at those 7 hospitals that I mentioned for about 20 years, and so that would take me from 83 to 2003. So in 2003, I left hospital radiology and helped open a couple of imaging centers in the Tampa Bay area. One of them is right up here on I-75 and Highway 54. So those are full-service imaging centers that do everything from X-ray, CT, MRI, nuclear medicine, studies, and so forth. And ultimately, after working at those centers for multiple years, Tampa General Hospital came to me and basically they wanted to buy both of those imaging centers. And so I, along with one of the other radiologists there, decided to go ahead and sell those centers. So at that point, I could have retired from radiology. But all along during my career, ever since 1987, I've also served as a forensic radiology expert, and I still continue to have a string of expert cases coming into me. So rather than fully retiring, I decided to continue with the expert radiology until such time that I do decide to retire. So with that in mind, that's why I'm here today. I looked at some imaging studies that you sent to me, and then part of that is if you're needed to come to court and explain those findings to the judge or the jury, that you would be willing to do so.
Okay, at this time I would move into evidence as 5 and 6, 5 being the MRI, and then the video starts. Mr. Funderburk, can you help me, please? Turn it on. May Ms. Flores step down while this is playing, Your Honor, please? Wait for the judge. Okay, Mr. Funderburk.
Mr. Reeves taken June 2015, Exhibit 6, being the X-rays taken of Curtis Reeves 2000, June 2015, pulse stimulated T-body state. Okay, close. Dr. Foley, you've had an opportunity to actually download the information that we provided you into your own computer, is that correct?
Yes, sir.
And is that what we have here on this table to my left?
Yes, sir, it is.
If you would, please, with the court's permission, Dr. Foley, would you come down and let's take a look at what we have here.
Okay, very good.
Dr. Foley will testify share his back as court to the state. Is there any way that we can hook up a microphone or something so that we can hear him, because he's really talking down into his computer away from us?
Just move the mic, I guess, down a little bit.
Okay, now, Dr. Foley, you've had an opportunity to look at both X-ray images and MRI, is that correct?
Yes, sir.
And what is the difference between an X-ray and MRI?
So, an X-ray basically is one of the oldest imaging studies around. X-rays have been known for over 100 years. An X-ray basically is a form of invisible light, and it was discovered that if one focuses an X-ray and shoots it through a body part, say with a film underneath, it can record images of the human body. So basically, an X-ray shows us bones very well. It allows us to see if there is a fracture or a dislocation, allows us to see if there are arthritic changes of the bones. And it's a common imaging study even today. X-ray does not show certain things though, like you cannot see the spinal cord on a spine study. You do not see the disc, you do not see the spinal cord or the nerve roots. So if we want to see those type of findings, we need to go to a higher imaging study, which would be an MRI, which stands for magnetic resonance imaging, sometimes referred to as MR, magnetic resonance. And it basically is not an X-ray study. It doesn't use ionizing radiation. It takes advantage of the fact that our body is composed of about 75% water, H2O, and it was discovered that the hydrogen atoms in water, when put into a magnetic field, give off a magnetic resonance, a signal that can be picked up by the MRI scanner. And it can locate each and every one of those signals of the hydrogen atoms in three-dimensional space and locate them in an X, Y, and Z plane. And so from all of this information, very accurate images can be constructed of the human body. So for the first time, we can accurately see the discs, the spinal cord, the nerve roots, brain tissue, all sorts of things that we couldn't see before on regular X-rays. So as you said, in this particular series of studies, we have X-rays and MRIs to look at.
Okay, and you've arranged them in kind of a logical order, is that fair to say?
Yes, sir.
Where are we going to start?
Well, we can start right up at the top. I've got them labeled 1 through 11, and so we can look at, first of all, the hands.
Let me ask you something before you get there. If you could pull back a little bit, please. What is its writing we see on the image, up on the left and the right-hand side?
Yes. So let me focus in on this. So this is just all the verification that the pictures we're looking at are of the particular patient we're talking about. So in this case, it says the imaging center, Rose Radiology, where the study was carried out. It says the patient's name, Curtis Reeves. It gives the date of birth, 8/31/42. States the patient is 72 years old. And then over here, this is telling us the date of the study. So this study was performed on 6/8/15, so June 8, 2015. So most of the images that we're going to look at were done on either June 8, 2015, or the MRI studies that we'll look at were done on June 9, 2015.
So what are we looking at here, Doctor?
So these are views of the hands, the right hand and the left hand. And what we can see is arthritic changes of both hands. But I'll focus in on some of the findings so the jury and the judge can appreciate this. This is the thumb right here we're looking at. And all of these are bones of the wrist, called the carpal bones. If we focus into this area right here, we're looking at what is called the radial carpal joint space. And this is the first metacarpal bone. One of the things to notice is how close the bone is to one another. So in other words, if we use this as an example here, notice that we see a space between this bone and this bone. That's because cartilage, which cannot be seen on an X-ray, separates the two pieces of bone. When the cartilage is worn down or worn out, we get this bone-on-bone appearance that we see here. So this would be an example of degenerative change of the first carpal metacarpal joint, where we literally have bone-on-bone. Also realize that bone reacts when it develops degenerative change by trying to thicken up the bone. And the thickening of the bone causes the bone to appear denser on the X-ray, and dense bone will look white. So if we look down here at the radius, so we're right at the wrist, this is the radius, this is the ulna. Notice that the bone is very white here. That is sclerotic bone or thickening of bone. Notice the bone right here and right here is very white, so that is more sclerotic bone. even note where we have the wearing out of cartilage right here, we also have this white line of sclerosis, which is a sign of degenerative change. As we look at the other bones throughout the body, or throughout the hand here, and this is the right hand, we can see narrowing of the interphalangeal joints. So the interphalangeal joints are the various joints of the fingers, and that narrowing is degenerative change there as well. White sclerosis is degenerative change. So this patient has degenerative change, particularly at the so-called DIP, distal interphalangeal joints, which are the distal most aspect of the joint spaces of the hand. So, and the left hand has similar findings. If we go over here to the left hand, notice we have narrowing of the various joints of the wrist, narrowing and degenerative change of the first carpal metacarpal joint, and then as we go to the interphalangeal joints, we see arthritic changes with sclerosis and narrowing of those joints. So basically both hand films show degenerative changes, both left-sided and right-sided, involving the carpal bones and also involving the interphalangeal joints.
And so when you say degenerative changes, what are you talking about?
So degenerative change is sort of a broad umbrella term to refer to wearing out of the joint space. So we know as we age, we have been moving our body parts for years and years, and that can lead to those joint spaces and those various body parts to wear out. And that wearing out process is called degenerative change. So you know, an analogy compared to like a tire of a car, if you just put a new set of tires on your car and drove the car for 10 miles and then checked the tread on the tire, it would be fine. Nothing much would be happening after 10 miles. But if you check those tires after 40,000 miles, the tread would be worn down to some degree. So that would be degenerative change in a way, or wearing out of the tire. Same kind of process is going on inside the human body, where we're slowly wearing out our various body parts over time.
And would you agree or disagree with me that those changes happen over a period of time and not overnight or maybe within the years?
Well, that's true. I mean, degenerative change in general takes years and years, so it's not something that pops up in 6 months or a year or something like that. It takes many, many years to get the kind of findings that we're seeing here.
Now, an individual with a similar x-ray, would it be consistent with somebody who, let's say, had trouble opening a jar?
Yes, well, particularly since we noticed that the degenerative change of the joints of the thumb are prominent in this patient. As we can see here, we see another nice demonstration of sclerosis of the bone. So typically a patient with this kind of degenerative change in this location will have a weakness of hand grip, for instance. And one of the things that people tend to notice when they have that is that the jar, they can't open a jar. You know, you have a jar of pickles or mustard, can't get it open because the whole grip of the hand is not as strong as what it used to be.
And you talked about distal phalange, you're talking about the fingertips?
So basically, that joint right before you get to the nail of the finger, this is where we're seeing degenerative change as well. So we're even seeing like this little osteophyte that's showing up right here.
And what's an osteophyte?
So an osteophyte is basically a bony growth. Osteo means bone and phyte means growth. So the bone, by constant rubbing bone on bone, develops thickening of the bone that eventually turns into these bony osteophytes that we see.
Now the x-rays we're looking at concerning the fingertips, I know not your term, the fingertips, would that be consistent with somebody who now has trouble maybe doing detail work with their hands, such as stitching, for instance?
Yes, when you have degenerative change in the fingers, we often notice we are not able to move our fingers as well, so sometimes that is reflected in their handwriting and, as you said, in any kind of detailed work that one might do.
Okay. If we look at, I apologize, Doctor, can we just look at the image number just so we can put it on the record, please?
So that image number that I had was number 1, which was of the bilateral hands. That was done on 6/8/15. And so now we can move to the wrists, take a quick look at that. So again, the wrists are this area of the hand, so that all of these carpal bones down here are part of the wrist. This is the radius right here, and this is the ulna. And again, basically it's showing us the same thing that we already saw in the hands, just a more focused down view. And it particularly nicely demonstrates the bone-on-bone appearance of the degenerative change of the first carpal metacarpal joint. So we're literally seeing bone-on-bone here with the dense white sclerosis of the bone, particularly involving the region of the thumb of both hands. And the next one we'll go to is the left shoulder. And the left shoulder is where obviously the humerus, the long bone in our upper arm, connects to or articulates with the scapula, which commonly, layman's term, might be considered like the wing bone, but in medical terms, this complex appearing bone, as outlined here, is part of the scapula. And the scapula has a curved cup-like shape called the glenoid, and the humeral head articulates and connects into this glenoid area. This part that we're seeing here is the collarbone, and over here is the acromion, and this area right here. And if we look over here, this is called the AC joint or acromioclavicular joint. And what we're noticing is that the patient has osteophytic changes in this region as well. So this pointed piece of bone here and the pointed piece of bone here is arthritic change of the AC joint. If we move over here, we can again see some more osteophyte here and here. So the important point of seeing the degenerative change at the AC joint is to realize that the rotator cuff, the muscles, and then the tendons come through this region right here and connect to this area of bone called the greater tuberosity. So in this region is sometimes referred to as the critical zone. And so as someone attempts to lift their arm up, this muscle and tendon system works as a pulley to lift the humerus up from this edge, but the tendon tends to get scraped across these osteophytic changes that are right here, which can cause pain in any individual patient and can scrape the tendon to the point that the patient can eventually develop what is called a rotator cuff tear, where the tendon is actually frayed and kind of sawed through that area so that the tendon eventually becomes completely torn.
And what we're looking at, again, the same sort of question in terms of time period. Is this something that's degenerative in nature, happens over a period of time, and not something that is the result of an acute injury, for instance?
That's true. Again, all these degenerative changes that we're pointing out typically take years to form. This is not something that you get in a relatively short period of time. So this is the left shoulder. If we move over here, that was number 3 on this list, so number 4 will be the right shoulder. If we look at this, not surprisingly, we see the same kind of findings. So here is the acromioclavicular joint. This is the clavicle right here. And this is the acromion process of the scapula. The space in between is the so-called AC joint or acromioclavicular joint. Perhaps the judge has heard of AC joint separation. Sometimes football players get this kind of thing where the AC joint is separated. But notice again here, just like on the left shoulder, we're now looking at the right shoulder, we see this bony osteophyte right here. And the critical nature of something like that is, again, the tendon of the rotator cuff passes through here and attaches over here. So with this piece of bone now in the way, it serves as a mechanism where it can scrape away and saw away, if you will, at the tendons of the rotator cuff, and can cause pain, can cause rotator cuff tear, for instance, in any individual patient.
Is an individual who has an X-ray like this, is it consistent with somebody who has difficulty raising their arm?
Well, it is, because realize again, the rotator cuff muscles and then the tendon come through this area and attach over here. I think we see it better on this, where it's the greater tuberosity. So if the muscle has to pull the tendon through this area, this tends to be painful. This often causes limitation in movement of the shoulders. It often causes the person not to use their shoulder so much because of the fact that it hurts when you do it. And so consequently, the muscles of the rotator cuff begin to lose mass and become what is called atrophied or shrink. So the muscles become smaller in size and become weaker. So it is not unusual when we see patients like this that they have limitation in range of motion, they have shoulder pain, the muscles in this region are often atrophied and have gotten weaker over time.
And in older patients, would you expect some atrophy whether or not we had such an acute, is that also called a bone spur?
Yes, sir. Bone spur is a typical layman's term, for instance, for an osteophyte, which is the medical term, which simply means osteobone, phyte meaning growth.
So my question was then, even if we didn't have that bone spur, would we expect in an elderly patient to see a diminished muscle mass?
Well, I think that's true in almost everybody. As we get older, we do lose muscle mass over time, even despite the fact that we try to go to the gym and work out and everything. It might help maintain some of the muscle mass, but we invariably do get weaker over time. We invariably lose muscle mass over time, despite our best attempts for most of us.
And might an individual whose X-ray looked like this have difficulty in picking up heavy items?
Well, that's true. I mean, anytime you have to use the shoulder, you're going to be affecting this area, and it could be difficult in any particular patient to lift heavy items up, to move the shoulder in general because of the limitations by the AC joint arthritis.
And is there anything else there you see that is of interest, Doctor?
I think those are the main findings on that, the type of degenerative changes that can occur. And so here, just to go through the anatomy a little bit, this is called the femoral head right here. This is called the greater trochanter. This is where tendons attach from the muscles in our thigh. Right here is the hip joint. And notice that we again have this finding of this dense sclerosis along the 11 o'clock, 12 o'clock, 1 o'clock region of the acetabulum. And again, the acetabulum is the cup-like shape of where the femoral head fits into the pelvis. So, and it makes sense that we would see something like that in this region because as a person is standing, they're putting a lot of pressure on the upper aspect of the acetabulum, and so the bone tries to add additional bone density, which creates a sclerosis, but is also a form of degenerative change. Also notice if one evaluates the vertical height between the femoral head here to there versus the vertical height of the femoral head from here to here, notice that it's narrower here, and that again is a sign of degenerative change of the hip. Same kind of other finding though, remember we talked about the osteoporosis, how we have some dense bone here, but lucent bone over here, lucent bone over here, lucent bone over here. This is all evidence of osteopenia, osteoporosis of the bone.
Anything else remarkable about the hip we're looking at, Doctor?
I think that's about it for the time being. We can go now to the left knee. And this again, we're still on 6/8/15.
And I forgot to ask you, I apologize. The x-ray of the hip and the degenerative properties that you described, is that something that we would expect to happen over time, as in the other x-rays?
Yes, again, typically degenerative change takes years and years to develop. So this is not something that just pops up in a year or two. It generally takes many, many years. I kind of, having gray hair, I kind of related to a person, how long does it take to get gray hair? You know, many times you're not going to be able to say, my hair went totally gray in a year or two. It generally occurs over a long period of time. So maybe in your late 20s or 30s, you have a few speckles of gray hair, and then your 30s and 40s, you got more gray hair, and now it's going from gray to white, such that by the time you get into your 60s, you have all white hair. So you could look at somebody like that and feel fairly assured that they didn't go from brown or black hair to gray hair in a matter of a year or two. It typically would take many, many years, whether it's 5 years or 10 years or 20 years, who knows for sure in that individual, but it would take more than just a year or two. And so the same kind of thing with degenerative change inside the body. It doesn't happen in 1 or 2 years. It takes many, many years to get that.
On to the knee.
So we'll go to the left knee now, and this is 6/8/15. So I'll show the judge this one first. This is so-called standing views of the knees, with the person standing up and the x-ray plate behind their knees, and the x-ray is shot straight through. So this is the left knee over here. This is the right knee over here, just to go over some anatomy. This is the femur, which is the long bone of our thigh, coming down to form part of the knee joint. This round piece of bone is the kneecap, or medically called a patella, right here and right over here. The two bones that are seen that go from the knee joint downward, the larger bone is called the tibia. Commonly people call this the shin bone. Sometimes we accidentally run our tibia into the coffee table or something like that, and this is that major, larger bone. The smaller bone out to the side of our calf, both left side and right side, on the outer side is the fibula. And so these are the two bones of the lower knee joint. So the knee joint is actually this part right here, where the femur bone comes together with a joint space, and then the tibia here and the fibula here. And what we're seeing basically in this is that we're seeing the medial knee joint, medial meaning the inside of the knee joint is narrow. It should be wider than this. And if we compare to the lateral knee joint, it should have a nice vertical height like this, but right here it's narrowed both on the right side and on the left side. In addition, we see sclerosis, this white thickening of bone along the tibial plateau. This whole area is called the tibial plateau here. And we've already learned that the buildup or thickening of bone is called sclerosis, a sign of degenerative change, and losing the vertical height of the joint is also a sign of degenerative change. And so the patient has a pattern that's typical for developing degenerative change in the knee, and that is it's affecting the medial side of the knee joint. And the court may not know that in most people, it's the medial side of the knee joint that wears out first in almost all people, and that's because just the angle of the way the femur comes down, when we stand, we put most of our weight on the medial aspect of the knees, and thus we tend to wear out the medial aspect of our knees faster than the outer or lateral aspect. And so it's quite common not only to get the degenerative bony changes like we see here, but also to get tears of the meniscus, the cartilage that fits in between these two bones. So the court may have heard of medial meniscal tears being discussed in other patients, other cases, and this is the reason why, is this is the area that gets the biggest workout. If we look at the side view or lateral view, and again we're looking at left knee here, notice that we see this patella from the side, the kneecap, and notice that we see the patella lying very close to the femur, the femoral condyle, almost bone on bone. Now realize the bone of the femur is capped by cartilage, and the back of the patella is capped by cartilage. So when one has degenerative change, the cartilage wears out and this bone-on-bone appearance begins to occur. And notice, if you want to see an osteophyte here, this pointed piece of bone right here is an osteophyte, bony overgrowth. So when this person is moving or walking, this patella would be rubbing bone on bone in this region, and this osteophyte would be scraping on the cartilage and on bone. A kind of finding that we all can get when we get in our 70s, just from the use of our legs and our knees over time. So that was the left knee. If we go to number 8, which is the right knee, again, we already went over this front picture, the standing view, where we see the medial right knee joint narrowed. But let's look at the side view for a second. And again, in this view, notice that the patella is high riding. That means we'd like to see this patella down more along this region. In other words, the top of this patella should be sitting down here more. And it's not, so one might question whether the person has had some previous injury to the tendons attaching to the patella. That would be the quadriceps tendon up here, attaching to the patella, and the patellar tendon down here. Nevertheless, we can see this bone-on-bone appearance, just like we saw in the left knee, on the right side, a sign of degenerative change of the meniscus. So basically, we have degenerative change on both knees, involving the medial knee joint, and involving both what are called the patellofemoral joint, meaning the patella and the femur are narrowed in that area, thus called the patellofemoral joint.
Would you agree with me that we can't see pain on an x-ray?
That is correct. We can see the anatomy on x-rays and MRIs. We cannot tell what severity of pain the patient may be in at the time, just based on the x-ray or the MRI.
But based on what we're looking at, would it be inconsistent with an individual that complains of knee pain, for instance?
No, not at all. I mean, it's quite common when people have degenerative change in their knees like this that they would have pain.
calling them degenerative changes, so we're talking about these changes happen over a period of time.
Yes, sir, typically many years. We then go, so at this point, we're gonna go from the 6, 8 studies. We've covered all the regular X-ray studies, and now number 9, 10, and 11, we'd be covering the MRI cervical, MRI thoracic, MRI lumbar, done the next day on 6, 9, 15. Should we keep going and go to the cervical now?
Let's do that.
Okay.
And before we go to the cervical, I noticed there looks like 6 images. How does a radiologist actually look at MRIs? Do they do it just in still images?
Okay, well, I'll show you. And just as an example, I'm popping up this still image, and we'll go more thorough to explain it about what this side view or sagittal view is and what this axial view. But if you'd like, I can just bring up the whole study so that the court can see how one would analyze a study. Is that okay? So if we open up this study, basically we can see all the different images that were performed on this exam. We can see that 9 survey images were done, then 15 sagittal images, so-called T2 weighted, which makes the spinal fluid white, 13 sagittal or side view, so-called STII or stir images, which allows us to see fluid signal particularly well, 13 T1 weighted images where the spinal fluid is back, and then 28 axial images. So to show the court how one might evaluate this, if we press on the sagittal images and make this larger so we can see it, notice when we first start looking at the side view, and just for orientation, this would be the person's chin here, and this would be the back of the neck over here. We're not really seeing any cervical spine yet, and that's because this initial image is taken off to the side, and then as we move forward, we're beginning to now cut into the cervical spine. Now we're into the mid-cervical spine, where we can see spinal cord, and as we cut through, we're cutting out of the cervical spine, getting to the opposite side of the neck. So just toggling through this, there's certain things that we can see. What we're noticing here, and if I zoom this up a little bit, this tall vertebral body in the cervical spine is called C2 or cervical 2, and then from there, once we identify that, we can count down to C3, cervical 4, cervical 5, C6, C7. One of the first things that we can notice is if we look at the back of the disc, we can see some discs are flat, like this disc at C2-3, and some discs are sticking out, like we see at the C5-6, C6-7 levels. So let's go now and look at an axial view. An axial is a cross-sectional view, and so if we look at that, we're now seeing, I'm going to bring this down a little bit. We're now seeing both the axial view and the sagittal view. The sagittal is the side view, the axial is the cross-sectional view. And if the court notices there's a line coming through the spine right here, and as I rotate this line moves. So this line is telling us what level we're cutting through which disc. So if we bring this line down to where the disc is the biggest, right here, and let's bring that over here, and let's adjust it a little bit like that. So what we can see here is that the disc is sticking out, coming very close to the cord, and the disc is sticking out here. Now I have a magnified picture of that so we can see it even better, which would be this view that the court can take a look at. And in this view, we can see that the disc is extending out and herniating out into the spinal canal. Now, just for orientation, this is the cervical spinal cord, this structure running up and down. The white is spinal fluid wrapping around the cervical spinal cord, and the disc sticking out shouldn't be like that. It should be flat like the disc above. If we want to talk about this disc, we call out the vertebral body above and below. So if I want to talk about this disc, I would say at the C5-6 level, meaning the disc between C5 and C6, there is a disc sticking out, and it's approaching the front surface of the spinal cord there. If we want to look at that in the axial view, we come over here, and in this cross-sectional view, all of this is herniated disc material sticking out into the spinal canal and lying up adjacent to the cord. Realize this entire area here should be white. It should be white spinal fluid. Here's the spinal cord right here. So this disc is sticking out and coming very close to the cervical spinal cord. If we go to the next level down and analyze this from the side view, the sagittal view, notice the disc is sticking out here. It's extending upward and extending downward. So this means that the disc has literally herniated out of the wall of the disc with jelly material extending upward and downward. So that is called a disc extrusion. And if one looks at the front margin of the cord, notice how the cord has like an indent here. That means, and that tells us that as this person flexes their neck forward, the cord bends over these regions, and the herniated disc has literally caused an indent into the cord in this region. If we look at it from the axial view perspective, notice how close the herniated disc is to the front of the cervical spinal cord. There's virtually no white spinal fluid here separating the back of the disc to the front of the spinal cord. And so those are the two most important features on this study. However, there's a lot of degenerative findings. For instance, the court may not know that the disc should have a white-looking center like we see here, but notice all these discs are black, 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 black. All of the discs that are black like this mean that they've lost the water content in the disc. So all of these discs should have a grayish-white center to them. That loss of water content is a sign of degenerative change of the disc, where fluid has leaked out of the disc over time. And
Why is that important, Doctor?
well, it's just a sign that this person has multi-level degenerative disc disease changes up and down the cervical spine, really sparing the C4-5 disc, but all the rest of the discs are all degenerated. If we want to see a nice example of an osteophyte, here is a bone spur sticking out here, bone spur sticking out at this level, bone spur over here at C6-7 sticking out, and in the back we have these herniated discs sticking into the spinal canal. So these findings are very significant because in general it is thought that the cord does not like being touched by anything except spinal fluid. So when you have these findings sticking out into the spinal canal, touching the spinal cord and lying near the spinal cord, this can cause symptomatology for a patient. This can cause weakness of the upper extremities for a patient.
And when you say symptomatology, what do you mean?
Well, symptomatology meaning pain, tingling, numbness, things of that nature would be the kind of symptoms one can get.
Okay, what do we have next?
Okay, so we're going from the cervical spine, which was number 9, MRI cervical spine. We'll go to the thoracic spine. So the thoracic spine, as the court probably knows, the neck is called the cervical spine. We've got 7 cervical vertebral bodies. The mid-back is the thoracic spine. There are 12 thoracic vertebral bodies. These are where our ribs are attached to our thoracic vertebral bodies. So we know we have 12 ribs on each side, and we also have 12 thoracic vertebral bodies where the ribs can attach. The key finding here, so there's lots of disc levels in the thoracic spine because there's one disc between each of the 12 thoracic vertebral bodies. But notice at first glance, all of the discs in the thoracic spine are black, they're darkened. That's called disc desiccation. So every one of these discs are degenerated up and down the thoracic spine. Notice that we have prominent osteophytes at some levels in the thoracic spine. But here's probably one of the more important findings is we have a disc sticking out in the mid-thoracic spine right here at T7-8, and it is immediately abutting the thoracic spinal cord. We can see it right here, and if we go over to this view, we can see it right here. So this disc is sticking out and immediately abutting the thoracic spinal cord. Again, the importance of that is just like in the cervical spine, this can cause symptomatology such as pain, weakness, tingling, numbness. It can also be a source of overall weakness to the person's back because of pressing on the spinal cord at that level.
Now, we're looking at a still picture, a static image. Is that how it works in the body? Does the spinal cord just stays in one place?
Right, well, that's an interesting question. Just like in the cervical spine or thoracic spine, obviously we need still images to get clear pictures of the spine and vertebral bodies and the core, spinal cord. But in real life, obviously, the neck flexes back and forth, the thoracic spine flexes and extends back and forth. So what happens is that this spinal cord actually moves and slides up and down within the spinal canal. And so the spinal cord itself can get scraped and roughened up by these discs that stick out. And we saw those 2 significant discs in the cervical spine and this one disc in the thoracic spine. So the point I think you're raising is that the spine actually moves, and so the spinal cord itself inside is going to be moving and scraping up and down against these discs and spur formation that sticks out. And that in and of itself can cause problems to the thoracic spinal cord and cervical spinal cord, leading to effects on the nerves that are contained in the spinal cord. So that's the thoracic spine, and then lastly we have the lumbar spine, number 11. And this was fairly remarkable because of this finding. So here's the lumbar spine. So we've covered cervical, where we have 7 cervical vertebral bodies. We've covered the thoracic spine, the mid-back, where we have 12 thoracic vertebral bodies. Now we're into the lower back. And for orientation purposes, these are the vertebral bodies. This is the lowest one in the lumbar area. This is called L5, then L4, L3, L2, L1, and then this is thoracic 12 here. So what I put an arrow on is this finding right here. There is a cystic appearing fluid collection in the lowermost tip of the spinal cord. So if we back up a section, probably most folks that aren't medical people do not know that the spinal cord itself ends typically at about the T12 or L1 level. It doesn't run all the way down to the lower part of the spinal canal. So if we look in this patient, here's L5, L4, L3, L2, L1. It's ending in the typical location of many patients where it's ending at around the L1 level. Some can end as low as T12, others go down to L1. But what we have is we have a fluid collection in the spinal cord. This is not normal, it's not typical. This is called a syrinx, and a syrinx is an abnormal fluid collection within the spinal cord itself. This can cause weakness because it affects the nerves running down the spinal cord. And we see this nicely demonstrated on the lumbar view at the T12 L1 level. And this is the corresponding axial view. And if you look at this for a second, here is the spinal cord. And this round hole, essentially, that we see in the spinal cord is the syrinx. So there literally is a cystic cavity in the spinal cord itself, which in general can cause weakness for a patient, sometimes incoordination of the legs, may even cause imbalance for a patient. Also look at the disc. We've learned to look for disc desiccation now. Look at the disc here. It's black, 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 black. These lower two have a small amount of remaining fluid collection in the disc, so this is some residual hydration in the disc. But we have multi-level degenerative discs. These discs are not, even these down here, are not as white as what they should be. They should be comparable to the white spinal fluid, and they're not. So all of the discs have become desiccated to some degree. If we look at one last finding here, we're seeing what is called an annular tear, and the court has probably heard about annular tears before, where the outer wall of the disc, called the annulus, is torn, and this can be a source of degenerative change and may cause symptoms for some patients. So really, we took sort of a whirlwind tour up and down the cervical, thoracic, and lumbar spine and saw two large herniated discs in the cervical spine. We saw a disc sticking out and touching the cord in the thoracic spine. In the lumbar spine, we saw a cystic cavity in the lower spinal cord called the syrinx. We see multi-level degenerative changes up and down the lumbar spine, and finally we see this annular tear in the lower lumbar spine.
This syrinx, is this a common occurrence?
No, it's actually rather rare. They can be produced by trauma, and they can be congenital, but if you lined up 100 people, you wouldn't hardly see it in one or two people of that entire 100-person population, so it's not a very common finding.
From the appearance of the syrinx, is this something that will take time to develop?
Well, it would. Even if it's trauma related, it takes time to develop, but something like this likely has been around for many, many years.
Thank you. I don't have any other questions.
Okay, thank you.
Want to take your seat, please?
Yes.
One last question.
All right.
Now, the opinions you've expressed today, are they all within a reasonable degree of medical certainty?
Yes, sir, they are.
I don't have any other questions.
Thank you.
Thoughts?
Yes, sir. Thank you, Judge. Afternoon, Dr. Foley.
Good afternoon, sir.
I'll go back a few minutes to the beginning of your testimony. You've been hired by the defense in this case.
Yes.
Did you sign an employee contract with them?
No.
All right. And your hourly rate to be paid in return for your services?
It's $750 an hour.
And up until today, how many hours have you put into this case at $750 an hour?
Well, the total bills, I think we talked about before, adds up to $5,000. $2,900 of that was review of the films, which are just flat fee charges. And then I had 2 one-hour conferences and spent about 30 minutes loading the films on the computer and selecting out the images.
And then you have your time here today,
Yes, sir.
which you haven't billed for yet.
Good night.
All right. Before we get into the individual x-rays and MRIs, you would agree that not everyone has the same pain threshold. That's a fair statement, isn't it?
True.
Prior to coming in the courtroom today, did you have an occasion to sit down with Mr. Reeves and conduct a medical history?
No, I want to make that very clear to the court and the judge that as a radiologist, I read the films of people, so normally I'm not sitting down, meeting the patient, talking to the patient, examining the patient. Basically, my exam of the patient, as most radiologists, is looking at the film, so we're not sitting there tapping on knees or taking a history, we're reading the films of the patient.
In this particular case, what was the years of the last films that you looked at prior to June of 2015 as far as x-rays of Mr. Reeves' hips, knees, shoulders, and fingers?
Those were all June 8th and June 9th, 2015.
Prior to that, what was the date and the years of the x-rays that you used to compare with the x-rays of June 2015?
These were the only films that I had, so I read what I was given.
You have no way to go back, say, on January 13th, 2014, and tell this court whether or not what we saw here displayed today was the same, substantially same, or even different than what was taken on June 8th, 2015.
Well, I think that's true to a degree. We know the findings are long-standing, that it takes many, many years to get those findings, but if no one takes an x-ray on a certain day, you can't with 100% certainty say what the film looks like on that particular day.
So what we were presented here today is simply the snapshot in the life of the medical history of Mr. Reeves on June 8th and June 9th of 2015.
That's true.
You cannot, to any reasonable degree of medical certainty, go back and tell this court that at the time of this particular incident on January 13th, 2014, that Mr. Reeves' condition was exactly the same as it was presented by the x-rays today. You can't do that to any degree of medical certainty.
No, I would not try to do that because I'd want to have a film done exactly that day. But I'm not trying to say that the films looked exactly the same either. I'm saying those films show degenerative changes that likely took a long time, many, many years. So more likely than not, I could say that these kind of findings pre-existed the date of the incident.
But you cannot say to what extent they existed.
I agree with that.
All right. And along those same lines, if we go back to January 13, 2014, it is just as consistent that the degree of the degenerative, what was the word after that?
Degenerative changes?
Yeah, the degenerative changes that you said have taken place over the years. You don't know to what extent on January 13, 2014, Mr. Reeves was aware of those due to any type of outward manifestations of pain.
Right, as I mentioned to the judge, I'm not trying to testify about what symptoms this patient specifically would have, because in order to find out symptoms, one would have to talk to the patient, interview the patient, and so forth. What my testimony was, based on the degree of degenerative changes, it's common for patients to have pain, but as you say, you could have two people that have the same degree of degenerative change, and one might say they have pain 3 out of 10, and the other person might say they have pain 8 out of 10. So there could be some variability among patients. I'm just saying that more likely than not, these findings pre-existed the date of the incident.
And along those same lines, on January 13, 2014, you cannot tell the judge as an expert to any reason free of medical certainty exactly what Mr. Reeves knew about his physical condition, correct?
Right, I would have no idea. You would have to interview the patient to know that.
And you did not know that,
No, my job is to read what I see on the films.
which were taken in June of 2015.
Yes, sir, that's true.
Okay. What I'd like to do is just very generally go through the different areas. All right. Maybe, I'm going to think about that in a second.
Okay?
We have a moment of counsel, Judge.
Amen.
Thank you. Thank you, Judge. No further questions.
Thank you. Any readers?
I apologize, Doctor, I forgot to ask you, is there another area of concern regarding the coaxial nerve? Mr. Reeves' MRI, you aware of?
Not quite sure what you mean by coaxial nerve.
Well, there's an opening where some nerves pass through,
Yes.
and
Are you referring to maybe spinal canal stenosis? Is that what you're talking about? Okay, yes, sir.
and did you identify any spinal canal stenosis in Mr. Reeves' images?
Yes, sir. Several areas, and the court might remember this, where we see the large herniated discs at C5-6 and C6-7. When the disc is sticking out into the spinal canal, the cord is actually being pushed back in the spinal canal, and so that tightness that is wrapping around the spinal canal, because the disc is pushing into it, is narrowing the space that the spinal cord can come down, and that tightness is called cervical spinal canal stenosis. So stenosis means a focal narrowing, and there is focal narrowing of the spinal canal at C5-6, at C6-7, and then again at the mid-thoracic spine level, T7-8.
And that would cause weakness, tingling.
Yes, sir, that's true.
Judge, since you brought up a new subject, now just cross on that.
Amen. Amen.
Dr. Foley, as I mentioned before, because you did not have any x-rays to compare, you cannot say as an expert to any reasonable degree of medical certainty that on January 13, 2014, that Mr. Reeves suffered from that condition to the extent that you saw in the x-ray that was taken in June of 2015. You have no idea what his condition was in 2014.
I understand what you're saying, and I will agree with you to the degree that it without having a film done on that exact day, you can't say what it looked like that exact day, but I can say within a reasonable degree of medical probability that more likely than not, those findings pre-existed the date of the incident. So I would say the person did more likely than not have cervical spinal canal stenosis from the disc abnormalities that are present. But again, in partly agreeing with you, because you don't have an exact film on the exact day, I can't say exactly what it looked like on that day.
So to any reasonable degree of medical certainty, you can't quantify to what extent that condition exists.
Well, yes and no on that, because I testified that it takes many, many years to get the kind of finding that we're seeing here. So if the time separation was about a year and a half, something like that, between the date of incident and the date of the films, and my testimony is it takes many, many years to get these kind of findings, so I would say more likely than not, the patient had similar findings to what we're seeing a year and a half later after the incident, and those findings existed prior to the date of incident.
And as we discussed before, every individual's pain threshold is different.
I agree with that.
And so an individual who, and I'm just going to use A and B because let's not make it too complicated. If you have a condition A and it gets worse to B, one person could have pain at A, but really another person could have no pain until they get to condition B, correct?
It's a possibility.
All right. And because you conducted no medical history of Mr. Reeves, and you have no comparison X-ray of Mr. Reeves on January 13, 2014, you cannot tell us any reasonable degree of medical certainty as to exactly how that impacted Mr. Reeves' daily activity and living on January 13, 2014. Right?
As I said before, I've agreed with you on that point because my job as a radiologist is to say what I see on the films. I did not do any discussion for the court on what kind of symptoms this particular patient had at a specific date and time.
Thank you for your time.
Thank you, sir.
And one thing you can be certain of is we're looking at an individual that's aging.
Yes, sir. That's true.
Probably a good time for a break. Let's take 10 minutes, ladies and gentlemen, and remember my instructions during the recess, please. And we'll see you back in a few. can be seated, thank you. All right. What do we got, Mr. Rosenwasser?
Your Honor, yesterday I was going through Mr. Knox's stand your ground and the deposition testimony and looking at the pictures of the mannequin recreation that Your Honor has. So I wanted to supplement my argument with this. I'm not 100% positive if all these factors came out during the argument. As the court knows, with respect to simulation case law, it's generally frowned upon. I wouldn't even consider this evidence as simulation. I would categorize this evidence as irrelevant, completely irrelevant, for the reasons that I'm going to discuss. And again, even if it was relevant, the relevancy of it would be substantially outweighed by the prejudicial effect. Okay? So in looking at these mannequins, all right, so this is what Mr. Knox has done. He's taken mannequins. So let's just use it. It's going to sound funny when I say mannequin Chad, but that's how I'm going to refer to it. Okay? So if you look at mannequin Chad is not the same height as real Chad. Mannequin Chad isn't the same body shape as Chad. He doesn't have the same face, musculature, dimensions, shoulder. Basically, just to sum it into one big argument, mannequin Chad does not even get close to real Chad. So it can't be relevant to anything in this case. Then you have, I sound so silly when I say it, mannequin Nicole, okay? Mannequin Nicole is not even remotely close to actual Nicole in any respect. Height, weight, dimensions, the way the body shapes. I mean, let's say that mannequin Chad is 2 inches, 4 inches, 6 inches off. That changes the whole quote-unquote perception that supposedly the jury's supposed to see. If Nicole Oulson isn't anything like Nicole Oulson, then the perception is totally off. It's not relevant at all, and it's so misleading for the jury because it's so inaccurate, it can't have any relevancy to the case. And that's just the very beginning of the analysis. So in the background, we have a movie that's playing that's not the actual movie that was playing at the time of the shooting. So the lighting in the pictures on the mannequin that doesn't represent Chad, that has to affect this perspective that the defense is putting out of the defendant. Then, let's just say for the sake of argument, which isn't the case here, that it was the movie playing. We do not know what scene was playing at the time. So let's say that they were in a car, versus they were in a house, versus they were at the beach. The scene lighting that we don't know would be different. You couple that with mannequin Chad that's not even remotely close to the dimensions of real Chad or even real Nicole. It can't get more misleading than that because we're having factors that aren't even at play in this case. It's not even like, well, maybe it's somewhat similar. There's nothing at all remotely similar to what's going on in this case. Coupled with that, this is what you have, and this is what I read from the deposition. In the deposition, the camera position is from Michael Knox sitting in the movie theater chair. It's not even as if the defendant was there for the recreation. It's Michael Knox sitting in a theater chair taking a photograph that now the jury's supposed to say, well, let's look at this picture taken by Michael Knox as Michael Knox is viewing it from a theater chair with mannequin Chad that doesn't even accurately represent real Chad against the backdrop of a movie that's not the movie playing, and the lighting conditions can't even be recreated because it's impossible. On top of that, the picture that was taken was from a tripod. The tripod was on the ground. So it's Michael Knox sitting, looking through a camera. The camera is on a tripod on the ground in front of Michael Knox, taking a picture of mannequin Chad that doesn't represent real Chad against lighting that doesn't replicate, nor could it ever replicate, the lighting at the time in the theater. It goes on and on and on. We don't know the distance. He has a picture of some random distance between the camera that's on the ground, mounted on the tripod, to this mannequin Chad. I'm not going to go through it 500 times about how it doesn't represent Chad, but it's just some random distance that we're now showing the jury so the jury can say, wow, this is how the defendant must have viewed this. It's really so irrelevant because it doesn't help the jury at all, because it has nothing to do with what the defendant saw in the theater at the time of the shooting. And has to do with the sheriff's office investigation, as we talked about the other day. There is no way anybody could ever recreate all those factors that occur in a movie theater. It's just not possible. That's why you have to rely on the video that's in evidence and eyewitness testimony, because that's the best evidence for the jury. There are so many different factors that I could keep going on about, but I think that the point really has been made, that there's just no way. I guess one of the other big things would be positioning. This was a dynamic event that happened. People are moving left, right, angles forward, backwards. This is a picture determined by Michael Knox, which is a snapshot in time determined by him in a chair at some camera level. That's his eyes, not even the defendant's eyes, but there's just no relevancy. It does not tend to prove or disprove how the defendant possibly perceived this event under the circumstances that he experienced it through. Because that's exactly what this whole issue is in the case. Did he reasonably believe that he was in imminent danger of death or great bodily harm? And really, only the people in the theater and the defendant himself knows that answer. This recreation or simulation, or however you want to characterize it, is simply not relevant, and any relevancy is absolutely outweighed by its prejudicial effect.
Response? Now, wait a minute. According to the case law cited by the state in Brown v. State, first DCA opinion, the standard is the demonstrative has to be an accurate and reasonable reproduction.
And then, so my argument would be, this is not even remotely accurate, and it's extremely unreasonable based on all those factors.
All right, and so as you were arguing that, what came to mind was, the differences and likenesses that are pointed out, say, in Williams Rule hearings. You can enumerate usually a dozen factors on each side. So you went through a litany of differences. Obviously, in Brown, there was a glaring difference of, styrofoam versus a human head. But so with that context, Mr. Escobar, what can you tell me?
Your Honor, first of all, this is for demonstrative purposes. Mr. Knox is not going to get up there and say, well, ladies and gentlemen of the jury, this is exactly what Curtis Reeves saw. It is a demonstrative aid to have the jury understand backlighting. Mr. Rosenwasser wasn't here for probably 95% of the arguments that we had yesterday, so he may not know that. But this was a demonstrative tool to be able to show the jury what backlighting does when someone stands in front of another individual. If the court recalls, their own witnesses talked extensively about the issue of silhouetting. And we can't assume here in this particular case that every juror actually knows the effects of silhouetting. I find it ironic, and I mean this with all due respect to Mr. Rosenwasser, but I find it ironic that this investigation, the crime scene investigation in this case, was an absolute train wreck, totally incompetent by the Pasco County Sheriff's Office, because they didn't preserve the things that they should have preserved. They should have done all these things there at the scene. And because now they're not there, and we're trying to bring back some of that evidence, some of that experience to the jury, they're saying, well, if we do that, if we allow that to happen, then the easiest thing that the government can do and the sheriff's office can do from here on out is they don't take up any evidence. Because if they don't take up any evidence, then certainly, it's not going to hurt their case, because you're never going to be able to go in and now present evidence in a form that is necessary for this particular jury to understand backlighting. These mannequins aren't there for purposes of saying, hey, listen, this is the perception that Mr. Reeves had with reference to these two bodies that were coming at him. This is a demonstrative aid. And just like that styrofoam head didn't mimic what a human head in that particular case did, you got to allow some flexibility. That's the reason. That's the issue of reasonableness. You have to. I'm sure in the Brown case that they didn't measure how long was the nose and how far apart were the eyes of the mannequin. And the mannequin didn't have any hair, and so why not put hair on the mannequin? We can't get beyond the fact that this is a demonstrative aid. And at no time is Dr. Knox going to say, hey, by the way, I did this because I want you to see that this is exactly how Mr. Reeves viewed the backlighting situation.
All right, and just to kind of clarify for the record, I think, as I recall the testimony regarding the silhouettes, you said the witnesses used that terminology extensively. I believe it was your terminology every time. They just said yes, silhouette, yes. Was it what? Couldn't you classify it as a silhouette? Wasn't it a silhouette? Or did you think it was a silhouette? I don't want to be leading, but because I'm sure you weren't leading. But yes, indeed, that's how I remember the testimony. Primarily your terminology, but nonetheless, silhouette has been testified to, which is why I agreed yesterday with the defense on this issue. Now, what about, all right, so Mr. Rosenwasser, you're pointing out all these differences. And obviously, again, in the context of a demonstrative as opposed to substantive evidence, there is a little bit of leeway there, obviously. What about that?
I don't think if you change the name of it, it makes a difference when you're doing a relevancy or 403 analysis. If it goes into evidence, that's one thing, but if they're going to see it as a quote-unquote demonstrative aid, they're still seeing it as if it is in fact evidence. So it's just more a different word, really, than anything else. Now, when the defense says that we're using it for backlighting, okay, I don't think the jury needs an expert to talk about backlighting. That was something that would be within the common sense purview of a layperson. People know what backlighting is, so we don't need Mr. Knox to come up and say, wow, here's an example of backlighting. Really, it's a perspective. That's what I submit they're trying to do. Okay? Silhouette. We don't have a jury full of kindergartners that don't know what a silhouette is. Okay? The silhouette is within the common person's experience in their lifetime. We don't need Michael Knox to come in and give expert testimony on it, because people hearing silhouette, backlighting, that's not terminology that requires any further explanation. It's in the common purview that people know based on their life experiences. Experts are used when there's information that goes outside the experience of what we'll say is a common juror. Backlighting doesn't do that. Silhouette doesn't do it. And I was thinking the same thing as the court. Our witnesses didn't get up and say silhouette. Now, you know, that's just kind of, this is what lawyers do on either side. So I'm not saying in the fault. It's a job of semantics, you know, and that's just what lawyers do. But really, we don't need anyone to explain this terminology because it doesn't require any expertise. To say, well, it's going to demonstrate backlighting, it's backlighting on a movie theater screen that doesn't even have the same movie playing at the same time. So we're looking at this white effect on these photographs. What happens if it was darker? What happens if it was a mix? It's completely inaccurate because nobody can ever recreate the scene. So I understand that they're saying that the Sheriff's Office investigation wasn't great. I'm admitting it wasn't great. I mean, any reasonable person would view this case and say it wasn't great. But no one in the world can recreate it. It's just impossible. Like I said, let's say they put the movie on the screen. You can't then say, here's where Chad Oulson was, and here's the angles, and this. You can't recreate it. It's just not possible, no matter who you are. So there's just no way to accomplish this. It does mislead the jury, and this terminology is not outside a juror's common experience that requires this type of evidence anyway. And the best evidence will always be the video and the eyewitnesses that were there.
Your Honor, it was a lot more than it wasn't great. As we know, in the law of self-defense, we have to have the trier of fact stand in the shoes of Mr. Reeves. I'm glad that Mr. Rosenwasser thinks that he is an expert on what jurors know and what jurors don't know with reference to the issue of
personal.
with reference to silhouetting, but we can't take that chance in a court of law. We never know what 6 members of a jury know and don't know. And I've been doing this for 37 years. I would never take that leap to just say, oh, well, you know, they must. The trier of fact needs to stand in the shoes of Mr. Reeves, which means the trier of fact has to be thinking of themselves as 71 years of age at the time. The trier of fact needs to be seated in the same seat as Mr. Reeves. The trier of fact needs to be in the same darkness as Mr. Reeves experienced. The trier of fact needs to be in the same low noise level that Mr. Reeves experienced. The trier of fact needs to be seeing the backlighting that Mr. Reeves was experiencing. The trier of fact needs to be in the same health condition as Mr. Reeves. The trier of fact needs to know the use of force and the danger cues that are taught to all police officers, and even more for Mr. Reeves. All of those factors, the jury has to stand in his shoes and make a determination whether his assessment that it was reasonable for him to fear death or serious bodily injury, whether that was reasonable. And so how cannot, the problem here is that the crime scene detective did not do a great job by any stretch of the imagination, and the detective, the lead detective himself, admitted on this stand that he didn't have the tools himself to investigate a self-defense case. And so now Mr. Rosenwasser is saying, well, you know, we didn't do it. We didn't capture it. We didn't do all these things that really should have been done in order to assess Mr. Reeves's perspective of what was going on. And so, but we don't want you to present it as a demonstrative evidence so that we can aid the jury somehow in making that determination. Mr. Knox is not going to be saying that what's on the view of the mannequins is exactly what Mr. Reeves experienced. The jury is going to determine all of this based upon all of the evidence that we're giving them. This is a demonstrative evidence just strictly on the issue of backlighting and an individual in similar size as Mr. Oulson standing in front of that seat 9.
All right. Thank you. I would have preferred to focus primarily on the argument. The issue that I've asked about is the accuracy. Is it accurate? And within the realm contemplated by the case law, do we have any more guidance on that? I can't get into Westlaw.
Judge, I think I read the Brown case. I thought that it is a very good. It's a flexible, yes, accurate, reasonably accurate.
Accurate and reasonable reproduction.
Exactly.
And there's 15 cases that cite this head note. I would love to see some of them if I could log into Westlaw, but I can't. So does anybody have any of those that more propound a little bit better description of what
We can
accurate and reasonable reproduction? So obviously Mr. Rosenwasser has pointed out some significant differences. I'm not quite as concerned about the backlighting and the exact moment because the pictures that I saw had a variation. There was a pretty good mix.
And we did that on purpose.
Light and dark. So, and obviously there's not any sound connected with this, right? And they're not moving, correct? So what are we talking about, the differences with the the mannequins, how much different are they from the actual folks? And the perspective.
Your Honor, they're a human body mannequin, just like the head in the Brown case was a styrofoam head. You're not required to exact every description or every feature of a styrofoam head, just like you're not required to do that with in a human body mannequin. That's why I'm saying that I think that these distinctions, are not the type of distinctions that we can attribute to a 403 argument. They're just not the type of distinctions that we can put a level of prejudice on. And so that's been my argument all along. Again, if I was going to have, Dr. Knox come in here and say, this is what Mr. Reeves saw, I'd be with you. I'd be with Mr. Rosenwasser. I'd be saying, hey, listen, I can't do that. We're not going to do that with our other experts. And so this is purely demonstrative for one purpose and only one purpose alone, and that is showing what happens when you have an object in front of, for example, Mr. Reeves, and backlighting, and what that does to that process. And I'm not going to take the opinion that these jurors all have experienced that and know exactly what backlighting is when someone gets in front of them with a screen behind them emanating light.
If this is not to represent what Mr. Reeves saw, it's not relevant. I mean, really, that's it in a nutshell.
All right, well, to put my decision into context, obviously the state is asking me to exclude some testimony and evidence that the defense feels is very pertinent to their case. So clearly I need to get this right. And I'd like to have all the information.
Judge, if you give us 20 minutes, we can do this. I frankly thought this issue was done yesterday. Nobody called me yesterday to tell me, hey, listen, get prepared because I'm bringing this issue back up again. If not, we would have done it last night.
I did say it yesterday.
Yeah.
We need to address the issue with Mr.
Yes,
Knox again
he
before he
did.
testifies.
He did. As I indicated, I'm sure we've all done plenty of Williams rule cases where you can have, the same sort of thing. How similar is it? And you can list 15 different similarities and then, maybe a few dissimilarities. And the case law is clear that it doesn't have to be exact, and typically it isn't. So you get that discretion in there. And Brown simply says, did the exhibits constitute accurate and reasonable reproduction of the objects?
Right. And if I could, I presented Brown to you, and you have to look at what the demonstration was for. You can't have a live human and place a knife in the skull to show the position so the jury can know the angles. That's what Brown was. So the styrofoam head served the purpose in order for the knife to be placed so visually they can see the angle which was relevant to how something happened. So did it fairly accurately represent that? Yes. There's a human head that is proximate. We all have basically a nose, cheekbones there. It was there, and it was at an angle. That's what they said. It had to be fair and accurate. Here, we have none of that. It's not fair and accurate at all. And so that's how we distinguish Brown. It's for what the purpose is. That was for the angle. This is what did the defendant see. And if you can't reproduce that, then it's not relevant. They were able to reproduce the angle of the knife in the skull accurately so the jury could have a visual representation. You can't do that here because of everything that Mr. Rosenwasser listed. And so it doesn't meet that standard.
Well, the argument in Brown was that, the defense argument was that there's no way to tell how deep the knife went in. There was no, that wasn't, that was an unknown.
But that wasn't the issue.
Well, it kind of was, whether he intended to kill her or not. And so they, wanted to know, it does make a big difference if it goes in deep or not. And so that's, like I said, just like with Williams Rule, you can point out as many as you want. There's this and there's this on both sides. And I'm just not convinced to the point that all of these disparities are enough. I'm just not. So I would like to, if there is any more guidance, particularly if there's something from the Supremes, that would be beautiful. About like just some analogies to what is reasonable reproduction.
Judge, if I can just have a suggestion, if maybe everybody can go to lunch early, and during lunch we will do it.
10:45 at lunch.
What, maybe just do another witness instead? And then
We don't have another witness instead.
Isn't Bedard here? And then just as the...
Bedard's going to be huge, and now then we're going to have a break in the middle of Bedard. We could get, I think, Knox. Knox is not going to be that, that long. My suggestion would be we take a break, we do the research, and come back and start.
All right, I'm gonna 10 minutes. I can go to my office and look this up on Westlaw in my office. I'll look at what we've got, and I'll give you my decision when I come back. That's what it boils down to. And I already indicated yesterday that I was going to deny the state's motion in limine regarding this, or I don't think that wasn't part of your Daubert, was it?
It was.
Okay, then
Because it has all to do with cameras and backlighting and whether it's
Okay,
accurate.
all right, that brings up the other issue. What about the camera? Where was the camera? How much difference is that?
The camera was positioned exactly where Mr. Reeves's eyes would have been, in his seat. There were measurements that were taken. I was there when that happened, and I can certainly speak to Mr. Knox and verify all that.
Mr. Rosenwalzer, you disagree with that?
I do. I have a copy of his deposition. And let me find the exact page and I'll show it to the court.
Because there comes a point when a lot of small inaccuracies can overcome a reasonable reproduction.
And I have it right here. Okay, this is page 101 of his deposition. Did you, and Mr. Martin, question, did you measure the height of the camera above the floor at the time you were taking the pictures? Answer, I don't recall if I measured the height of the camera. I set it at my eye level as I sat in the seat. So I sat in the seat pretty much straight up and set it to my eye level, but it was a tripod right in front of my eye. Did you take measurements of what your eye level was? No, I did not. And then then he talks about how the tripod was put on the floor in front of the seat where he was sitting, where he took the picture of his own eye level.
And how tall was Mr. Knox?
I don't know, Judge. I would have to ask him.
And
Yeah, I can tell you he's not
also
as
you have
tall
to
as
take
my
into
client.
consideration where he was sitting. Was he leaning to the left, like Joanna Turner said? Was he leaning back in his seat? There's so many different variables about the height of his eyes. I mean, it's just impossible to recreate this. I mean, I can't think, like when you ask the question, which is, what else is accurate or inaccurate? There's nothing about this is accurate other than the fact these pictures are taken in the Cobb Theater in a seat. That's the only thing that's accurate. Every other variable is inaccurate.
Reasonable reproduction.
there is no reasonableness in it because there's nothing remotely accurate other than the fact the pictures are taken in Theater 10, and they weren't even taken in a seat because the tripod's on the ground, so you can't even use that. The only thing that is reliable or reasonable or accurate is the pictures were taken in Theater 10.
The mannequins appear to be of human beings.
Okay? But human beings have 5,000 different variables. Probably my mannequin and we'll use Mr. Martin's mannequin look very different. So just saying a generic mannequin that looks like a human body doesn't mean anything because we're very different body styles.
Are they similar?
No, it's just a mannequin in a human form. And it really does matter. The broadness of the chest, the broadness of the shoulders, the head, the neck, all of that makes a person unique. This is just some generic mannequin, so it's not reasonable to have a generic mannequin, and it's not even reasonably accurate because all it is a mannequin.
Judge, again, whether you're 5'7", whether you're 6'1", it's the backlighting. That's the demonstrative issue here. It's the backlighting. He continues to try to gravitate, to trying to tie this demonstrative aid as saying, this is exactly what Mr. Reeves saw. That's not coming in. We're trying to show the effect of the backlighting when someone, in this case it was a human body, but you could have a backlighting and have something even smaller than this just go in front of you and it's going to have some of that effect. So we're not trying to tell this jury that this is exactly what Mr. Reeves saw. It's to show the effects of backlighting when a human body comes in between the backlight and the individual that is viewing that. So if you're 5'7", it doesn't mean that the backlighting doesn't occur. If you're 6'2", it doesn't mean that the backlighting does occur. It's the body coming in front. He's trying to gravitate his argument to suggest this is what Mr. Reeves actually saw. I would agree with him. I would agree with him. Under those circumstances, you shouldn't allow it in. That's not what we're doing.
All right. Let me take 10 minutes.
Recess for 10 minutes. Jonathan, I just shouted the jurors in here for a moment.
Yes, please do. thanks. Okay. All right, I did find a few cases of interest. Ultimately, I got to Chamberlain v. State, which is 881 Southern 2nd, 1087, Supreme Court of Florida case, which cites their previous ruling in another case. It was a recent ruling. Said in Chamberlain, the standard for allowing demonstrative evidence at trial was recently reiterated by this court in Harris v. State, 843 Southern 2nd, 856 at 863. That's a Florida decision, 2003, wherein we stated, demonstrative evidence is admissible only when it is relevant to the issues in the case. It is essential in every case where demonstrative evidence is offered that the object or thing offered for the jury to see be first shown to be the object in issue, and that it is in substantially the same condition as at the pertinent time, or that it is such a reasonably exact reproduction or replica of the object involved that when viewed by the jury, it causes them to see substantially the same object as the original. The person offering such evidence should be required to give a good reason for its acceptance into evidence, and this is particularly true if the object be not the original but only a replica or a facsimile. The determination as to whether to allow the use of a demonstrative exhibit is a matter within the trial court's discretion. So, Mr. Escobar, I believe
I've got a Supreme Court case from 2018 dealing with mannequins in and of itself.
All right, what is it?
It's called Lowe versus State, located at 259 Southern 3rd, 23. It's a 42-page opinion. However, I have outlined the areas that they deal with mannequins. I believe they start at head node number 5 through 11. I've only got half the opinions being printed right now.
So give me the site again. 259 3rd.
259 Southern 3rd, 23. It's a 2018 Supreme Court of Florida opinion. It deals specifically with mannequins. I'm handing that to the court. And my other pages should be here momentarily.
Teresa was right outside. She says, do you want her to
Can you see? tell me what relevance?
Judge, I think that when you look at that particular case, they were actually using the mannequin for.
Wait a minute. Just tell me what the relevance is, please.
Oh, the relevance for our mannequins is the
Yes.
backlighting.
The backlighting is relevant to what issue in the case?
To what Mr. Reeves could have experienced, the backlighting, what Mr. Reeves would have experienced in the theater.
Okay.
Meaning not that exact mannequin,
Okay.
not that,
Okay,
but the
okay,
backlighting.
that's all I asked.
Okay.
One more.
Yeah.
So how is that issue relevant to Mr. Reeves' defense?
It's relevant, Your Honor, because it actually blocks the light that was coming from the theater screen, which actually causes shadows in the individual that is causing the backlighting. That's the whole purpose of the backlighting issue, is that phenomenon actually causes shadows when you're looking at it.
Okay. What issue are you trying to bring forth?
I'm trying to bring forth the issue that this was Mr. Reeves's perspective, the actual backlighting. He actually experienced that during the actual shooting. And so because we have to stand in his shoes in order to be able to make that assessment, we need to have that factor, just like all the other factors that he was experiencing that day. Backlighting was a factor that clearly, because Chad Oulson stood up.
Okay,
Okay.
okay. All right, and in this Lowe case, has the state had the opportunity to review anything to do with the Lowe case?
I have, and if it's okay, because I'm reading it, to argue from a seated position.
You may.
The mannequin was used by the medical examiner in order to demonstrate to the jury the trajectories of the bullets. And in the Lowe case, and I'm looking at head note, well, not head note, I guess it is head note 5 in the body of the opinion, it indicated, quote, the medical examiner then used the mannequin, which was slightly taller and thinner than Burnell and had valves inserted into it, to demonstrate the relative trajectories of 3 bullets that entered the victim's body. The medical examiner testified because he could not state what position Burnell was actually in when she was shot. He could only give anatomical, not spatial trajectories, and that the trajectories had a small degree of error. And the court, in overruling the objection, actually asked, what would be the difference if it was off a few degrees one way or another? Because the analysis was, as the court was indicating, is it reasonably accurate? Is it reasonably accurate reproduction? And that was why in the Lowe case, that mannequin was able to be used. In this case, Mr. Escobar just indicated exactly what our argument was. He wants to argue that this is the defendant's perspective. And there is no way that this camera, held by a tripod on the floor in front of Mr. Knox sitting in his seat, could possibly replicate the defendant's perspective. The only person that knows the defendant's perspective is the defendant himself. So that's exactly what we thought he was trying to admit for, to say this was the defendant's perspective of the backlighting. It can't be any more misleading than that. Only the defendant can have, it's his choice whether he wants to testify or not. I mean, Michael Knox can't say, based on a picture I took using my eyes, that this is what the defendant's perspective was.
No, he can't say that. But
That's what their argument was just now. This is being shown because you asked him what's the relevance, and his argument was the defendant's perspective of what the defendant saw regarding backlighting.
Your Honor, the issue is backlighting itself, not what is shown on those mannequin photos, because Mr. Knox can't say this is exactly what Mr. Reeves says, but the phenomena of backlighting is what's important to us. And something that's very interesting in the Lowe case. In the Lowe case, they used those mannequins for a far more intricate forensic analysis than what we're using it for. And by the way, our mannequins are 5'9", so they are going to err on the side of conservative, because if they were 6'6", okay, they'd be arguing, wait a minute, is blocking, more light. Our doctor actually did it far more conservative at 5'9". That's the relative size of the mannequin. And so I would say that what we're using it for is strictly for the backlighting effect.
All right, a couple of things of note. In the low case, it points out the fact that the mannequins were not specifically identifying or made to look like the individuals involved so as to perhaps evoke an emotional response from the jury. So I didn't see any issue with that in these mannequins. And so obviously it would not, according to the Supreme Court, it would not be a good idea to use mannequins that are, you know, more identically patterned after the individuals involved. Secondly, I lost my train of thought. The overall impact, the size, as you indicated, Mr. Escobar, I believe in Chamberlain, which I cited earlier, the state used a much larger version of the weapon.
Asp. It was an asp.
Yes, and the court found that that was okay. In this case, as you indicated, this is a smaller mannequin. I understand the distinction there. Obviously, if you used a much larger one, that would be subject to further scrutiny, but in this case, as you indicated, it's more conservative. This is within my discretion, and in considering all of the aspects, the case law, the reviewing the photos that were provided to me, I am going to overrule the state's objection to this demonstrative, and we'll get to it.
Your Honor, could we have just a limiting instructions? I don't know the best way to craft it. Maybe something to the effect of this testimony is being offered only to demonstrate the concept of backlighting.
Judge, I'm gonna go outside with the court's permission in a little while and instruct Mr. Knox, to stay within the parameters of his opinion, and that's only as to the fact that backlighting is created when an object comes in front of that backlight to create the shadow. That's going to be his testimony. He's not going to say anything beyond that. It was never intended to do anything else.
All right, so if there was a limiting instruction such as Mr. Rosenwasser indicated, I don't see any harm in that either as to that portion of his testimony. Say it again.
This testimony is being offered only to demonstrate the concept of backlighting.
All right, I think that's fair as to that portion of his testimony. So can we
I would agree
pause?
with that. And Judge, I would agree with that. I don't have any problem with that. That was our intent from the very beginning.
All right, so we can pause briefly before he begins that portion, which will include the PowerPoint.
I will make sure that that happens.
All right.
Can
then
I go and
let's-
talk to Mr. Knox now?
Yes,
And
please.
try to get that before you go.
Just one thing, the fact that they used a mannequin, I mean, it is kind of interesting to demonstrate the backlighting. So I've intended to ask him, and I don't know how you want to handle it. I don't want to open the door into Pandora's box, so to speak. That in this case he chose to use mannequins. He could have used any object at all, but he chose a mannequin. I mean,
Judge, he chose a mannequin because of the fact that if he would have chosen a TV like this and it would have been, very, very dark, then we would have gotten objection. The reason is a mannequin is a human body. Human bodies have arms, they have areas of the neck that are a little bit.
Okay.
That's why we
So
used
Mr. Knox can certainly answer that without opening Pandora's box. Just that simply.
I will talk to him and make sure that he is.
Okay.
Give you an idea of what Mr. Knox said about why you use a mannequin and not a board or something, if that's what the court wants.
I don't care.
Okay.
If Mr. Rosenwasser wants to bring that out on cross, I'm sure we'll hear. It's not that I don't care, it's just, at this moment, I don't care. It's okay. And that's up to Mr. Rosenwasser when he does his cross, but as I indicated, that's not going to open the door for every other thing to come in.
Yes, Your Honor.
It'll be answered accordingly, and we'll go from there. All right, let's bring the jury back in, please.
Jurors in the courtroom, Your Honor.
Okay.
Jurors may be seated. Jurors are present and accounted for, Your Honor.
Thank you, ladies and gentlemen. Were you all able to abide by my instructions during that brief break? Hopefully. All right, thank you. We're going to get started again. Mr. Escobar?
The defense would call Dr. Michael Knox.
Walk around this way. All the way over here where we can see the clerk. Listen that right hand, raise your right hand, face the clerk.
Do you solemnly swear or affirm the testimony you shall give in this cause will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Okay, now let's just sit down and see the chair.
Good morning, Dr. Knox.
Good morning.
Doctor, would you please pronounce your name and spell it for the court reporter, please?
My name is Michael Knox, and first name's common spelling, last name is Knox.
Dr. Knox, would you please, I'd like to review a little bit about your educational background. Let's start with your educational background, if you can. Your college experience, obviously.
Sure. I have a bachelor's degree in mechanical engineering from the University of North Florida, a master's degree in forensic science from the University of Florida, and a PhD in criminal justice from Nova Southeastern University.
Let's talk a little bit about each one of those degrees that you received. First of all, your associate's degree. Let's talk about what the areas of concentration were for those.
For associate's degrees, I actually have two. One is an associate in arts, just general education, and then I also have a associate of science in criminal justice technology.
Okay. And when you went to get your bachelor's, what was your, I believe you indicated your major there was engineering?
Right, mechanical engineering, that's correct.
Explain to the ladies and gentlemen of the jury what that all entails.
Well, mechanical engineering is the branch of engineering that deals with the design and operation of machinery. So in a engineering degree, you're doing heavy math, doing all the calculations to calculate things like stresses and strains in a machine, and heat transfer, fluid flow, and all sorts of things like that. So it's very math intensive, a lot of physics and mechanics involved, and you're dealing primarily with things that would involve moving machinery. So that's sort of the area of engineering.
You also received, as my understanding, a master's degree. Is that correct?
That's correct.
And that was in forensic sciences. Explain to the ladies and gentlemen of the jury what forensic sciences are.
So the forensic science program at University of Florida, they have different tracks, but the one that I did is the general forensic science track. So it's sort of a variety of different courses related to forensic science. Some of them are just general forensic science concepts, statistics, and various things like that. And then I took courses in things like bloodstain patterns, forensic entomology, which deals with the collection of bugs at a crime scene, and the utility that they have. Forensic biology and forensic chemistry, all different things like that. So sort of a general overview of the forensic sciences with a lot of detail on the technical side and the application of it.
You then also received your PhD in criminal justice. I know there was a focus of that PhD as well. Explain to the ladies and gentlemen of the jury what that PhD entailed.
So the PhD in criminal justice is primarily a research degree, a scientific research degree. So what you're doing there is applying a scientific method to criminal justice related problems and looking at various types of data. So you would be looking at things like it might be a particular criminal justice program to treat an offender. Does it work? And then you'd have to do the statistics to be able to figure out, is it actually effective, or does it not change the outcome? You could be dealing with all different sorts of problems, whether or not a particular laboratory procedure was effective, just by applying, again, statistics and a methodology to that. And then I had a concentration within that of behavioral science, and I actually did my dissertation on the crime scene behaviors of school rampage shooters within that.
Let's talk a little bit about your law enforcement career. Tell the ladies and gentlemen of the jury when you first started your law enforcement career.
So I started as a police officer with the Jacksonville Sheriff's Office here in Florida in December of 1994. And I was a police officer in uniform for about 5 years, 5.5 years. And then I went to the crime scene unit. So at the Jacksonville Sheriff's Office, all of the crime scene investigators are sworn police officers. So after you've done a certain amount of time as a police officer in uniform and patrol, then you can transfer to the crime scene investigations unit, which is part of the detective division. And so I spent 7 years there as a crime scene investigator, training coordinator, and then I left that unit in 2007 and spent 3 years as a traffic homicide investigator before I left the agency, took an early retirement in 2010.
Let's talk about those years as a crime scene investigator, and tell the jury, if we can, what is a crime scene investigator?
So as a crime scene investigator, your primary role is to document and collect, preserve, and in some cases analyze physical evidence from crime scenes. So your primary focus is on the physical evidence, and your job is really to secure everything and to first document and then to assess it and apply appropriate procedures for being able to collect, process evidence, for example, processing for fingerprints or collecting samples for DNA or doing things like that, as well as doing other things, maybe documenting bullet trajectories or bloodstain patterns or things like that.
So 3 of your years in that department was as a major case crime scene investigator?
Actually, I was a major case crime scene investigator for almost the whole time that I was in the unit.
So for the entire 7 years?
Yes. So what happens is you come into the unit, and once you've gone through training and you've gotten sufficient amount of experience that they feel comfortable letting you be the lead crime scene investigator in major crimes, which would be homicide cases, serious sexual battery cases, ones with injury or things like that, or police-involved shootings, or there's certain enumerated offenses that would be classified as major case designated, and you have to be designated as a major case investigator to be able to be the lead crime scene investigator on those.
And that's what you were for Jacksonville?
Yes.
And you also, I believe you indicated you had a title of training coordinator. Tell the ladies and gentlemen of the jury what that training coordinator position also entailed.
So from 2003 until I left that unit in 2007, I was in charge of training everybody else in the unit. So that meant I was providing a lot of the training to other people, new people that would come in. I would give them training, as well as do ongoing training with those people who were already in the unit. And then also I made sure that if there was any outside training available that people were able to go to, that, kind of organize that and send the appropriate people and those sorts of things.
Now, it's my understanding that you also had some coursework, some work within your department, for example, in the Institute of Police and Technology. Let's go through some of those if we can. Tell me what you did for that particular institute.
Well, I did went to a lot of training courses there over the years. So it's the Institute of Police Technology and Management, which is a training center for the University of North Florida. And IPTM trains police officers from all over the country, but even internationally, in a lot of different fields. They have a forensic science, forensic investigation section. So starting from the late 90s on forward, I took a lot of courses there in traffic accident reconstruction and things like that. And then probably starting early 2000s, crime scene processing and homicide investigations, crime scene reconstruction, bloodstain pattern analysis, and a lot of other courses related to crime scene work, use of alternate light sources and things like that. And so I took, I don't know how many, but probably at least 15, 20 different courses from IPTM from the late 90s up until about the mid-2000s.
Some of those courses also included lighting optics, is that correct?
I've taken the course on lighting optics and visibility for forensic investigator. That was actually not IPTM, it's another training company that put that on. taught by a lighting engineer, person who had a background actually designing lighting and systems and stuff. And that course dealt a lot with the documentation side, how to photograph lighting conditions and how to be able to take measurements and things like that.
There was another course that you took, lighting and visibility for the forensic investigator?
Yes, that's the course I was talking about.
Okay. You had a Glock Advanced Armorers course. What's that about?
So I've actually gone several times up to the Glock factory up in Smyrna, Georgia, and they put on what they call armorer training. So basically an armorer is a person who is certified by the company to work on their pistols. So if you go through the Glock armorer training, then you're certified to work on all models of Glock pistols, which includes diagnosing if there's something wrong with it and changing out parts if the parts need to be changed, things like that.
You also took a course called Street Survival Seminar, is that correct?
I actually took that one twice, way back in the 90s, actually right before I went to work for the Jacksonville Sheriff's Office, and I took it again in, I don't remember exactly what year, but early 2000s.
What is that course about?
So there was a company called Caliber Press that they publish a lot of books and things that it's training literature for police officers. Most of what they deal with is tactics for police officers to survive armed encounters and things like that. And so I've been to that training twice. First time because of becoming a police officer, and second time because it more from the investigative side of staying current on what's being taught to police officers for them to do, so that if I went to police-involved shootings, that I could, stay current to that information and know what type of evidence to be looking for.
You took a course on digital photography, is that correct?
Yes, I've actually had several different courses. IPTM has a digital photography course that's digital photography for law enforcement. I've taken that one twice. And then I just a couple of years ago actually took a couple other digital photography classes. One on autopsy and injury photography, and I'm trying to remember the other one.
You also took your courses on homicide investigations in general?
Yes.
And how many of those did you take?
I took one 40-hour class at IPTM that's on homicide investigations, and then I took another one on, it's titled Injury and Death Investigation, which was at the Police Academy in Jacksonville in the 90s when I took that class.
Certificates that you currently hold?
I've had multiple different certificates. I actually was certified by the International Association for Identification, which is a forensic institute that has a crime scene certification program. I held their crime scene reconstruction certification for 10 years, but they decided several years ago not to continue that particular certification. So for those of us like myself whose certification expired toward the end of last year, they didn't offer a renewal. But I did hold that certification. I had to go through the process of getting that, which is you have to meet certain requirements, and then you have to take a test and then a practical in order to be able to get it. And then I did another test and practical 5 years later to renew it.
And you that lapsed when? You said last year?
Just the end of last year.
So in 2014 you had that certification, is that correct?
I did, yes.
At some point in time you left law enforcement, is that correct? Tell the
That's
ladies and gentlemen of the jury why that happened.
I started doing consulting work as a part-time, and I began to get too busy when basically was working 2 jobs. And so I was able to take an early retirement, invest my time, and leave and still get a pension, eventually. So I made the decision to leave the Jacksonville Sheriff's Office and then go full-time into the crime scene reconstruction consulting business.
And what is your specialization in your consulting work?
So crime scene reconstruction would really be what I would call my specialty, with other things that go underneath that, with a particular focus on shooting incident reconstruction. So the majority of the work that I do is reconstructing shootings or firearms involved incidents. And of course that includes doing things like bloodstain pattern analysis and bullet trajectory work and things like that.
Members of associations?
Primarily, I'm a member of the Association for Crime Scene Reconstruction, or what's known as ACER, which I've been a member of since, 2008 or 9, something like that.
Are you still a member of the American Society of Mechanical Engineers?
I did not renew that one, I think, in the last year or two. Primarily what I've decided is, in terms of focusing on professional organizations, is that's related directly to my field. So ACER would be the one primary organization.
Have you been published in the past?
I have.
And let's talk about some of those, and we'll probably go from the, I'll give you just a few. Forensic engineering applications in a crime scene reconstruction. Did you author that paper?
I did.
Okay, and was that paper also peer reviewed?
It was.
And would you explain to the ladies and gentlemen of the jury what that means, being peer reviewed?
So a peer-reviewed paper, technical paper, or scientific paper is one where you submit it, and it has to go through various steps of approval, and one of those steps is that it gets sent usually to 2 reviewers who are experts in that field, or that have the appropriate background, who will then review that paper and make a determination as to whether or not it meets the scientific rigor for whatever publication or whatever conference it's being published at.
Another one that you did, the forensic engineering analysis of ejected cartridge case patterns for reconstruction of firearms-related incidents. You wrote that paper as well?
Yes.
And was that paper also reviewed?
Yes.
Forensic analysis of an accidental firearm discharge due to a blow to an exposed hammer spur. You did that one as well?
Yes.
Forensic engineering analysis methods employed for the purposes of determining the location of long-range shooter based on terminal bullet trajectory. Did that one as well?
Yes.
And I won't go through all of them. Okay. Books. Tell us about books.
Well, primarily, I was involved in, and an associate of mine had written a crime scene processing manual, basically on A to Z's of processing a crime scene. And then for the second edition, rather than updating the book, we took the entire book and turned it into an online format, which basically was delivered on a DVD, so that somebody could put it in the computer, and that allowed us to actually include not just the text and the photographs that were in the book, but add videos and multimedia stuff to be able to sort of explain and demonstrate all different kinds of crime scene processes. So if a crime scene investigator needs to know how to document a footwear impression, we had that in there, explaining how to do it, and had videos actually demonstrating the process. If they needed to be able to take measurements of something, then we had it in there to be able to explain that. So we sold that for probably about a 10-year period. I don't think that there's been any sales on it in the last couple of years, but for a while it was published not just by us, but also a third-party company that sold forensic equipment and supplies carried it in their catalog.
Teaching, have you held some teaching positions?
Yes.
And would you tell the ladies and gentlemen of the jury about your teaching positions in the area of crime scene investigations, and specifically in forensics?
Well, the main teaching that I do is for the Institute of Police Technology and Management, where I am an adjunct instructor, and I am the lead instructor for shooting incident reconstruction classes. So I teach that class every year in Jacksonville, and then we teach it periodically on the road if an agency requests it. So I think the last time I taught it out of town was in Sacramento, California for the California Highway Patrol. And then I've also have taught as an adjunct instructor. I taught a forensic, it was a forensic science class for Kaiser University, and then I also taught a class on crime scene and forensic investigations for Flagler College.
Have you also taught and lectured abroad?
I have.
And would you explain that to the ladies and gentlemen of the jury?
So I taught a shooting reconstruction class in the Republic of Georgia, not the state of Georgia, the Republic of Georgia, over next to Russia, and that was under contract with the U.S. State Department for the Georgian police. And then I've also taught a couple of courses, general crime scene courses for a company called Searchy Fingerprint Laboratories, which is a company that manufactures and sells crime scene equipment and supplies. And I taught that course in Dubai, in the United Arab Emirates, for the police and their forensic science laboratory there. And then I've taught that class twice to different groups of prosecutors and medical examiners in Peru, in 2 different cities in Peru.
And have you been qualified as an expert in the field, in your particular field?
Yes.
And can you tell me if that was in crime scene reconstruction?
Crime scene reconstruction, shooting incident reconstruction, bloodstain pattern analysis, and several other related sort of subfields of the crime scene reconstruction.
Let's start out about talking about how is it that we engage and investigate a crime scene from the very beginning. What do you do as a crime scene investigator? What are you required to do as a crime scene investigator when you first take on that responsibility?
The first part of whenever you get there is just what I call data collection, or collecting information, essentially. That's going to start with information where you're going to get at least some idea of what's the nature of what happened, and then you'll begin to assess things like what's the extent of the scene, where did this all take place, what kind of physical evidence is present, and you begin documenting that. So initially what you're really trying to do is just document and collect everything and gather all the data that you can gather without really making any decisions on anything. You're not trying to figure out really at that point exactly what happened or who was involved. You're trying to figure out what evidence is there and what information do I need to collect, what do I need to document, and what's going to give me the information that we're going to need to be able to start piecing everything together. And then as you document through photography, through measurements, through actual collection of different types of evidence and various different types of processing, depending on what you're looking for, then you would move into where you start to piece things together and figure out what it means. So now I have information and I know this, and so what does that mean? What does it tell me about what took place? And then you begin just steadily and methodically working through all that to be able to eventually get as complete a picture as you can of what actually took place and what is it that you need to find out.
So are you telling me then, well, let me ask you this question. Does a crime scene investigator just go into a crime scene and allow the crime scene technicians to do whatever they want to do or whatever they feel is appropriate to do? Or is a crime scene investigator heavily involved in the entire process of the investigation?
You should be heavily involved. So but basically what you're going to have is in a situation like you have here in Pasco County, where you have non-sworn forensic investigators and you have a detective that's assigned to the crime scene whose job it is to oversee what's going on, then the biggest piece of what's happening here is communication back and forth between the detectives that are doing interviews and that are finding out different pieces of information and making sure that that's communicated with the forensic investigators who are actually doing the evidence collection and documentation. Because you have to have some idea of what's going on to really know what to collect, to know what evidence to process, and to know what's important. If you don't really know anything, then you wouldn't know what's out of the ordinary, what's part of the scene that's ordinary and isn't really part of what took place, and those kinds of things.
How critical is that aspect of doing a proper investigation? Knowing what others are gathering in the form of information.
That is, you really couldn't overstate the necessity for that. You have to make sure that you're communicating, that you know all the information that's coming in, because you can find out things in a crime scene where somebody, there may be something that's related, and you have no idea that it's related because that hasn't been communicated. So you have to find out not just what's there in terms of physical evidence, but every piece of information that you may know about a crime. Even when you have a crime where nobody witnessed anything and you have nobody alive to tell you what took place, as a crime scene investigator, I still need to know what information is known. Things like when were people last seen alive, or what's the parameters of what took place? Where might things have happened? Where did this person go? What do we know about it? So there's a absolute necessity for communication going between the detectives that are doing all the interviewing work and the crime scene investigators and technicians that are documenting and collecting all the evidence.
Obviously, there could be two types of cases. One is who did it, right? And the other one is what?
That's right. Basically, you can understand physical evidence in two terms. What we call associative evidence, which is evidence that tends to associate things with people or things with other things, or maybe things with a location. And associative evidence typically goes toward the question of answering who. Who was involved, who did it, so sort of the classic of that would be like I was giving the example of a homicide. You get there and there's a body. And what you know is that this person's been killed, and that's all you know. Somebody found them. When you go to a scene like that, your primary focus is on associative evidence. What am I looking for that's going to help me identify who was here to try to figure out who actually committed this crime? The other type of evidence that you deal with is what's called reconstructive evidence. So that's evidence where you're using it to figure out what happened, not necessarily who. Now, you can be doing both in some cases where you're looking at associations and reconstruction of what took place. But certain cases, and this would be one of them, where the who is not really a question. So the real focus is what happened, and what you're doing with the physical evidence there is going to be centered on determining what took place.
So the dynamics of what happened is critical in the gathering of relevant evidence. Is that a fair statement?
Yes, I think that's a fair statement.
And so how do you go about then gathering the information that you're going to use to try to preserve evidence of what happened? How do you go about that?
It begins with having, you have to know and understand what's the extent of your scene and where your evidence is going to be found. Because then you know where to search, you know where to what areas to document, what stuff to measure, what things need to be collected, and what's the area that you focus on. But you can also have things that you're looking at that aren't necessarily like a piece of physical evidence that you're trying to find, but documenting things like if you have an incident where you have a number of different witnesses, then you could be also needing to identify where were these people and what were they looking at when they saw or heard or perceived various things that they've discussed or have told the detectives, so that you can document from their perspective. And there's a couple purposes on things like that. You're actually documenting where they were so that it's known, but looking at things like how far away is the person? What's the line of sight for that person? And you can also get into what's the lighting, what would they see under the lighting conditions, things like that. Because the idea is, one, to be able to test what anybody says for accuracy. Is it correct or not? And two is just to be able to have a record of that later as to, from this perspective, you could see this. So that's why you're communicating back and forth, and then you're looking at everything that you need to document, collect, and in a particular scene.
Obviously, you know this is a self-defense case.
Right.
And so how important, we're just going to get back to the witnesses in just a second. How important is it for the crime scene investigator and the lead detective to determine whether there has been contamination that may have taken place there at the crime scene? How important is that?
That's something you'd want to make sure you knew as much as you could about what happened in terms of the scene. And by contamination, you can have a lot of different things that can take place. One being is whether or not physical evidence is moved or touched or anything has happened to it between the time that the incident took place and the time that you're arriving there to document. If anything got moved, then you need to know that it got moved, and you need to know where it came from and try to get the best possible evidence as to where it originally was. Where did it come to rest when everything ended? As well as making sure that all the evidence is handled such that you don't destroy anything that might potentially be important. Because it could, even though you have a shooting scene where you're really focused on reconstructing what happened, there can still be important associations and associative evidence that you could be looking at, trace evidence of things, maybe DNA or fingerprints or things like that, that could tell you what events took place. One I get on a not infrequent basis is where somebody's, say, struggling over a gun, so we need to know that there's some type of struggle that took place with the gun, because we could be looking at DNA or fingerprints from the people who were struggling over the gun to try to verify whether or not they actually were struggling over the gun. So that's really the importance there.
So we talked about contamination, obviously, with evidence. Is there such a thing called contamination of witnesses?
Yes.
And explain to the ladies and gentlemen of the jury what contamination of witnesses entails.
Well, the biggest thing with witness contamination deals with not wanting witnesses to talk with one another about what happened, so that each person that you interview and get information from is giving you their recollection of what happened. And they're not getting pieces put in it from conversations that they had with other people. Because what you want to know is what does that person know? What did they actually see or hear? You know, where were they? And you want to understand how certain they are about it. Whereas if they've talked with other people, then they may have had additional information added to what they recall, to the point that by the time you interview them, that those things can no longer be separated.
Would you agree or disagree that individuals that sometimes listen to others actually start believing that they themselves may have seen or heard what they've been contaminated with?
It happens frequently, yes.
And tell the ladies and gentlemen of the jury how dangerous that is in our criminal justice system.
Well, the biggest problem with that is that you're not getting that person's actual knowledge and recollection of what happened. And see, when you're doing crime scene reconstruction, I can't take what a person tells me and then I don't have some magic way of knowing whether it's true or not. What I have to do is take what they say and compare it to the physical evidence to see whether or not what they say is possible or not possible, whether it's consistent with or inconsistent with physical evidence. And so you have to be able to assess those factors within what a person tells you that are reliable pieces of information and those pieces of information that aren't reliable. When people begin to talk to one another and begin to adopt things that they've discussed amongst themselves, then you begin to have multiple witnesses telling you things that perhaps if they had been separated and they had not communicated with one another, you would get a piece from one witness, and you might get a different piece from another witness, and then maybe a different piece from another witness. And that helps you to be able to separate what people actually know and saw and heard, as opposed to getting kind of the chicken soup at the end, where multiple different people's recollections are kind of thrown into one bowl and they can't really tell who actually saw and heard what.
And so the issue of separating witnesses, is that a concept that you learned early on in your law enforcement career?
Pretty much a day one concept. Yeah, pretty much.
Meaning your initial training as a police officer, the police
Right.
academy, I should say.
Right.
They teach you this concept of you come to a crime scene and you do what? Witnesses are there. What do you do?
Yeah.
Separate them, right?
Yeah, you're in police academy training. You would, as a patrol officer, would be taught your first priority when you arrive at a crime scene is safety, making sure that there's nobody that's about to be hurt. Second priority is making sure that if there's an outstanding suspect and somebody that may potentially be dangerous, that person is dealt with. Your third priority is secure the scene and make sure nobody touches anything and does anything to change the scene beyond what it is right now when you got there, and that you're very close to that would be your priority of separating witnesses and getting people off to places where you'll be able to interview them and get their recollection of what they actually know about what happened.
And so you've talked about the dangers of contamination. What happens when you come onto a scene and you realize that multitude of witnesses are talking to each other? How do you handle that problem, if you can?
Well, if you've already got where people are beginning to talk to one another, you want to separate them still as fast as you can, because they may have talked about certain things, but the longer you let them stay together, then the more they're going to talk about what happened. So as fast as you can, you need to separate them. But then what you would do is, in that process of interviewing people and figuring out what they saw, you need to sort of understand, if you came up and there are people that are talking to one another, keep track of who's talking to who, so that you'd know that these people were in conversation with one another. And you ask them too in an interview. You can ask the person, have you talked to anybody else at this scene? And then you can also start to look at things like, when you have multiple witnesses telling you the same thing, to question them about, did you actually see that, or did you actually hear that, or is that something that you heard from another person? Because sometimes the person will tell you, they'll say, oh no, I didn't actually hear that, so-and-so told me that. And then you're able to clarify, okay, that person doesn't actually know, they're not actually a witness to that, they were told that that's secondhand information. So you can deal with it. Obviously you can't unring the bell of anything that they did hear, but you can at least try to get a handle on what they heard and what contamination may have happened.
Would you agree or disagree that becomes even a much greater problem if you have an emotional scene, for example, in a shooting? And if so, why?
It is always, one of the biggest problems with dealing with scenes, especially in the initial few minutes of arriving at a scene, is that there's a lot going on, a lot in terms of what's happening. If you have a lot of people there, then you have a lot of emotion going on. You have a lot of things happening, and you have to separate people, not just from the standpoint of them not communicating, but it also helps calm the whole thing down. Because when you let people sit quietly and reflect quietly on something, then they'll have a tendency to calm down more than if they're talking to one another, and perhaps conversations can get people going. You sort of want them to get them thinking of what they remember and kind of get calm in that, and it'll be easier to interview them once they've had some chance to calm down.
The process of trying to investigate those witnesses that have been contaminated, would you agree or disagree that part of that process is actually testing their recollection? Meaning, where were you seated? How far were you from the seat 9? Taking them back actually at some point in time into the crime scene. Is that something that should be done when you realize that there is contamination in your crime scene?
It's good to do even without contamination, but to take a witness and actually interview them at the place where they were. You can interview somebody in a separate location, get preliminary information, go through their account of what happened, but it's a really good idea to take that person back to where they were to walk through it, because a lot of times it'll help them to sort of trigger their memory, where they remember things, because now they're actually seeing. So they're looking out there, and they're actually sitting there looking at the seats in the movie theater where they saw things, and they're able to sort of get an understanding. And sometimes you get witnesses where you take them back, and they've told you stuff, and then you take them to a location. You say, okay, now was the person over there? And they'll stop and look and go, I remember this being over here, or this. In other words, they realize that there was something faulty about the way they recalled it, and now seeing the scene and being back in that environment, they recall it differently. So it's a good idea to do. Plus, as I said before, if you take a witness back to the location where they said they were, you can determine whether or not they could have even seen what they said they saw. Sometimes what happens is you take a person back, and then you realize that there's a line of sight problem. They couldn't even have seen it, or there's something in between, or there's some type of issue that maybe they couldn't really have seen what they said. So it's a really good idea to get them to show you, and not just go back in and look at it, but have them demonstrate it. Where were you? Okay, you were sitting in the chair. Well, how about having a seat back in the chair? So you turned and you looked over your shoulder. Okay, can you show me how you looked over your shoulder? And go through that whole process with them.
And do you document that, and do you preserve that process as well in a crime scene diagram or in some other form, so that others like myself at some point in time can see that?
Yeah, the primary ways that you can document that is photography is one, and by that you could photograph the area where the person was, and then take pictures from where they were back in the direction of where they were looking to see what they saw. You can include them in a diagram. So that's quite typical, would be to put a diagram together and then show each person's location on that diagram. Measurements. You could collect a measurement from where they were, say just a straight line measurement, over to where they were looking, so that you have some record of how far it was. And then you can also, during the process of interviewing them, you can audio record it, or you can even video record that interview with them, so that it's all completely documented and recorded for any need later on.
Let me ask you a question about recording, which is maybe somewhat interesting. Law enforcement officers don't have to tell the individuals that they're interviewing that they're recording them, right?
That's correct.
Perfectly legal, right?
That's correct.
You don't have to, spook anybody that you're recording them. You can put the recorder in your pocket and fire away.
That is correct.
Is that correct?
Yes.
Okay. Is that a tool that's used quite often by law enforcement?
It is. It is. A lot of times if I was interviewing somebody with in person at a scene or something, I would have a recorder out. I would let them know that, but I would by no means required. In fact, depending on the particular location and stuff, you can even record people without you being present. So, for example, the backseat of a police car. It was not uncommon that we would have a recorder in the backseat of a police car, primarily where you had maybe two people that you believed were involved in a crime, and you could put them in the backseat of the police car, turn the recorder on, or some of the units now even have wireless microphone systems, so the officer can stand outside and listen. And then they have a conversation. Hey, tell them this. Then you know that, and so then you're able to challenge them with, well, you said this, but you and your buddy just made that up in the backseat of the car, didn't you? So you can freely record certainly any conversation that you're a part of.
What we've been talking about, and I'm going to call it verifying a witness's statement or refuting it through forensic processes. Is that more important in scenes where you have the incident occurring with limited lighting?
That's one of the biggest issues, really in a lot of scenes, but certainly something here, like in a movie theater where you have atypical lighting conditions. So not like we have in this room where we have fairly, fixed amount of light that's steady throughout the room and it's pretty consistent throughout the room. Obviously in a movie theater, while you have something playing on the screen, the lighting conditions not only are quite a bit darker than normal lighting like this, but you have lighting that's constantly changing because of what's on the screen. So that is something that becomes really important to understand how that would affect what anybody saw or perceived, and you'd want to be able to document those things.
Would that likewise be important when you have a scene where, for example, in this case, previews being played loud?
Sound also, yes, is an issue because particularly where you have people that are reporting things that they heard, that you want to make sure that they could hear it and that there wasn't going to be any interference with what was playing, and that in fact everything that they were hearing was coming from what was going on in the movie theater as opposed to what was being played on the screen.
Would you agree or disagree that two of the most important senses that we have as human beings are your sight and your hearing, right? Why is that the case? Why are they so important?
Well, in most of the time when you have somebody that is what we would call a percipient witness, a person who perceives something related to that's going to be they either saw it or heard it or both. It's not uncommon where we'll have shooting cases where a person never actually saw anything, but they heard something. Sometimes you have cases where they don't hear anything. Maybe they're inside a house and they're looking outside and they see it, but they don't hear it. But obviously, if you have a shooting incident that takes place in a room and there are people there, then potentially they're going to both see and hear it. That's probably about the only thing they're going to really perceive, but they will certainly see and hear based upon what they're looking at and what they're able to hear.
And that influence of light and noise, could that have an impact on the accuracy of what they're saying?
It could, because again, just like talking about line of sight and going to where the person was, the lighting conditions can affect what they could see. I can obviously see a lot better in this room with lights on than I would be able to see in it if all the lights were turned off. So you'd have to really, you want to know that. You want to understand what could a person actually see based upon those lighting conditions and how it's going to affect what they saw.
Would you agree or disagree that there are tools that are available to preserve lighting conditions and noise conditions?
Yes, there are.
And would you tell the ladies and gentlemen of the jury what tools forensically are available in order to preserve both lighting and noise conditions?
Lighting conditions can be documented with photography and can be documented with taking a light meter and actually getting readings of how much light there is. And then sound similarly can be documented. You could record it, and you can also use a sound level meter to see how loud this particular sounds are.
Would you agree or disagree that in a self-defense case, the perception of the accused is extremely important?
It is important, yes.
And so, would you agree or disagree that the individuals that are investigating a self-defense case should certainly have the competence to know how to deal with those particular cases, correct?
Yes.
And so if you had arrived at a crime scene and the lead detective in the case clearly did not have the competence to understand and investigate a self-defense case, tell ladies and gentlemen of the jury what you would do.
Well, one of the things you have to do anytime that you're investigating any type of a crime scene is know your limits. Those limits can be based upon your own knowledge and training. Those limits could be because you don't have the equipment. Those limits could be because you just don't have the experience with it, and you're not comfortable in terms of having enough practice, basically, with a particular process or something that you need to do. And so you have to consider your outside resources. The biggest thing with a crime scene is that once you get there in law enforcement, you can control that scene as long as you need to. There's not anything that legally prohibits you from holding a scene. You may have to get a search warrant, or you may have to get, go through some hurdles, but those are easy hurdles to go through. And I have worked crime scenes where we've held a scene for 5 days, and potentially longer if you needed to, because once you let it go, it's gone. You have to assume that whatever evidence you wanted is gone, because even if you went back and found it later, the argument is you didn't preserve the scene. How do you know that that's the evidence that was there? So you have to do that step. You have to document all these different things, and if it requires getting outside help, that outside help is available.
And where would that outside help be available if you need it?
Well, the first place that, being a police officer in Florida, the first place that I would look to for outside help would be the Florida Department of Law Enforcement, because they have forensic science laboratories at various different regional laboratories throughout the state. And so they have a lot of different people and provide a lot of different forensic services through their laboratories. If FDLE is not able to provide that service, then your next step would be looking at other law enforcement agencies, perhaps federal, FBI, Bureau of Alcohol, Tobacco, and Firearms and Explosives. They have their own laboratories and their own experts in various things. There could be other ones. And then past that, if you can't find it in a forensic science laboratory, a government laboratory, or law enforcement agency, then you look to private sector people like myself that do stuff. And I actually have done some cases where I've been called by law enforcement and brought in to help them with whatever particular issue that they were dealing with, in order for them to figure out what happened and be able to make a decision as to whether or not to arrest somebody.
Would you agree or disagree that if you have the lead detective who is not well versed in the issue of self-defense, would you agree or disagree? Just speak to the rest of the detectives, right? Find the detective that does have that experience. Is that a difficult thing to do?
No, in most agencies, you got somebody in the agency that's got some background with that. So, yeah, the detective that gets there may not be the one that's got a lot of background in it, but if there's other detectives, and typically when you're at an agency, you already know. I mean, these are people you work with, so you know who it is. That I would get calls because I had kind of had a specialty in doing shooting reconstructions and stuff, where detectives would come to a scene, there'd be another crime scene investigator there, and the detectives would, next thing I know, I'm getting a phone call from my supervisor saying, hey, the detectives on the scene have asked for you to come out there. Because they recognized that I was able to do things that maybe the ones that were out there didn't have as much experience with. So, that's, you could easily, between your own agency and other law enforcement agencies, and then worst case, the private sector could find the assistance that you need.
Let's continue on this road of perception if we can for a bit longer. Is the environment of where a shooting takes place, is the environment important, and if so, why?
Well, the main issues that you have with respect to environment, it's always important. There's always going to be something about it that you need to understand. But you need to be able to understand the constraints within a particular environment, meaning what things limit what could have taken place. So, here you're talking about a movie theater, and you have people sitting in rows of seats. I mean, we pretty much all, anybody that's been in the movies knows what that's like when you go in and you sit down, and especially if you're not at the end of the row and you're in the middle of the row and you have to go from the end of the row to where your seat is, those kinds of things that create constraints as to what could take place. There's a lot of chairs in the way. You have a very limited space between there. You also, in a movie theater, you have things like step down from one level to the next level. That's not, normally if you're in a room like this, it's all at the same level. In a movie theater, it's not. So you have to be able to document all those things to know how is that affecting what could happen and what somebody could see or perceive.
Let's talk about some of those issues that in the environment could possibly affect perception. Would you agree or disagree? I think we've talked about lighting. That's an easy one, right?
Right.
And we've talked about noise. That's an easy one. Is that correct?
Yes.
Physical layout. How does physical layout sometimes affect one's perception?
Physical layout really, more than anything, has to do with, like I said, the constraints, the ability to move, the ability to see what's there and what could, affect how you perceive something, as well as just the general space. How does it affect movement? How does it affect the way somebody can move or react to something that's happening? Things like that.
Now, in this particular case, we had video cameras, surveillance cameras in this theater. Is one going to get the same perspective that the accused has if he's sitting in seat 9, back row, as you get from a video camera that's up 30, 35 feet up in the air?
No.
And explain to the ladies and gentlemen of the jury why you don't get the same perspective.
Multiple different reasons. I mean, not the least of which is that the video camera is not really giving you the same perspective. Even if I had a video camera sitting right next to my eye right now, the camera and what people would see watching that video would not be identical to what I see. But the location of it is significant. In fact, one of the training, whenever I teach a shooting reconstruction class, I talk about video quite a bit because, especially nowadays, it shows up so much in the cases that we work. I have an example case that I use where there's two different in-car, it's a police-involved shooting, there's two different cameras, police cars that have in-car video cameras that record the incident.
Objection relevance to the question that was asked.
It's very, very relevant. He is explaining that process and that problem.
And what happens there in this particular one is one of the reasons why I train on exactly this topic is that the first video camera, you play it, and the way that the shooting looks is it basically looks like a guy's walking away from the police and they shoot him in the back and kill him. And even in a room full of police officers, you play the first one and most of them like, wow, what was that? And then you show them the second car, and in the second car you see the guy pull an object out that looks like a gun, point it at one of the officers, and there's a lot of information that's not captured. So whether you have multiple cameras or even multiple witnesses, wherever I am, I'm seeing something that even somebody that may be close by me doesn't see exactly the same way I saw it. And certainly a camera is the same way. If I've got a camera that's way mounted up on the ceiling over there, it's not seeing this incident the same way my eye sees it at the time.
And so what do you do with that? That's a problem. How do you try to compensate for that?
Well, the main thing there is to document as much as possible from the viewpoint of any given person that you're dealing with, whether it's a witness or whether it's the person that's actually involved in a shooting, to get their perspective. So if you have, say, a shooting like this, where you have a person that's in a movie theater seat and shoots somebody, I would want to go back to that movie theater seat and have them show me, just like I would with any of the other witnesses out there. I'd want to bring that person back in, put them back in that movie theater seat, and have them explain everything from that perspective, and then look at it. They say, I saw such and such. Okay, can they see that from their positioning? What kind of lighting? And you can go through really in detail with them. What was the lighting like at that point? What could you see? And get the details of it, and then document that the best that you can with photography and video, if possible, and those kinds of things, to be able to know and one, keep a record of it, but also to sort of test the veracity of what you're being told.
And if you're in a theater like the Cobb Theater, and would you have the ability to go to management and say, I want you to turn that lighting to mid one?
Certainly. I mean, as long as that the movie theater's cooperative, which in this case it was, then you could simply ask the management what, I myself went to the movie theater and did exactly that and said, show me the lighting level. And they explained the different lighting levels, and they set the different lighting and things like that. And of course, if you needed them to replay whatever was on the screen, things like that, just ask them to do it and see what what you're able to document and do with that.
And if they refuse, you have subpoena power and you have search warrant power, right?
That's right. Investigative subpoena, which basically, as a detective, all you got to do is go to the state attorney's office and ask them to prepare an investigative subpoena. And then you can also, if necessary, get a search warrant. Draw up a search warrant, take it to the judge, have it signed, and then and at that point the theater doesn't have a choice.
Dr. Knox, in a situation like that happening in the theater, would you yourself, as the crime scene investigator, would you sit in that theater and have the lights dim to mid-level one and have the previews played?
Objection, relevance.
I'll overrule.
Would you?
I would, yes. I would routinely in shootings look at those kind of things, and in fact, I even teach it when I teach a shooting reconstruction class and talk about documenting lighting conditions and things like that.
Why would you sit yourself there and have those parameters for viewing? Why would you do that? Why is it important?
Well, several things. Part of it is that you're documenting, because you don't know what questions are going to come up later on. You don't know what issue may arise later on as you go through an investigation, so you want to document what's there. But also, more than that, is because here's a scene where you're trying to reconstruct what happened, that's at the center of reconstructing it, is knowing what are the conditions, everything in terms of the conditions at the time that would affect what a person saw and perceived and what they're responding to.
In you mentioned bringing the accused to sit there in the seat What sort of information would you want from the accused in your questioning of the accused in order to give you a good perspective over what the accused was possibly seeing and knowing at the time?
Well, you really want to understand, with whether it's the person that's the shooter or any person, the witness or anybody, you want to know what it is that they say that they saw, and you want to test it. Because obviously if something that a person is telling you is inaccurate, particularly if they're the person involved in the shooting, you want to confront them with the fact that it's inaccurate. So you might find something that as you bring them in, you test it, and they've described something, and then you realize that's not possible. So then you would confront them with, well, that's not possible. So, explain to me why you say this, but this couldn't have happened. Because one, you're giving them the opportunity to correct if there's something wrong in their recollection, or you're trying to see what a person may be doing. So if a person's being deceptive, for example, you keep testing them on those things, and then you just find that they keep changing their story, and that would tend to lead you to, think that maybe they're not being truthful. So it's not just about coming in and then just taking what somebody says at face value. It's about testing what they say to make sure that it's true and accurate and it's correct.
Obviously, you have participated in police-involved shootings in the past. Is it important to know, in a police officer shooting, for example, the body of knowledge that the police officer has?
Yes.
Your Honor, I'm going to object to that. May we approach?
Yes, you can approach.
Dr. Knox. To the crime scene investigator. It's a self-defense case. And you know that the person that's accused is a retired police officer. Would you want to know the body of knowledge that that police officer, former police officer, had in threat assessment and realizing the cues of danger? Would you want to know that if you were the crime scene investigator and the lead detective?
You would. Primary reason is just so you understand from a person's training and background, things like their knowledge and ability to handle a gun, how would they handle it? So if you've been through training, for example, law enforcement training, then there's certain ways that you shoot a gun that you're trained to do that somebody who's never had that training would not necessarily inherently do. But also you want to look at what it is that he's looking at and what he's aware of in terms of cues and indicators to him that may have led to the decision to fire. So as a crime scene investigator, I'm primarily looking at trying to identify those things and then figure out, what is it that he saw? And that's going to be within the framework of his knowledge and training, not just that he saw something, because what does it mean to him? And so then you know better how to document that. So what do I do to document that so that it shows what he's perceiving and whether or not what he's describing to me matches up with what he's saying. So again, it's a matter of let's figure out what he made his decision on, and then we need to document all those factors to the best of our ability to be able to show that, if there's a particular decision that he made, was it made on, was that a reasonable conclusion from his
Your Honor,
point?
I object.
So let's continue with this perception factors that we talked about. I think we left off with physical layout. Video surveillance, we talked a little bit about that, did we not?
We didn't.
Okay. And so how important is it to a crime scene detective or crime scene investigator to realize, first of all, whether there's video or not?
Video is,
I'd object only because I thought this was asked and answered. We went through a video already, but I don't know if there's more, but.
All right, to the extent that it's been asked and answered, sustained.
video is important to document it, to be aware of as a crime scene detective, because one, it can potentially show you very important evidence. One of the biggest things we get out of video in terms of reconstructing, particularly in a shooting, is timeline. Because when witnesses are telling you about something, you don't really know exactly how fast it happened. You just know what their approximation. So if you ask somebody, well, you know, you heard this and then a shot is fired, how long in between those things, they're giving you an estimate. But with video, you can often go to it and know exactly between an event to another event. Sometimes we get video when you have multiple shots fired. We can know exactly the cadence and the speed with which the shots are fired because of what's recorded on the video or audio. So you need to look at it. You need to know and be aware of it because until you know it, until you've seen it, until you've had a chance to really analyze it and look at it, you have no idea what it's going to tell you.
And so, if you go into a theater and you see that there's a surveillance system, you just tell yourself as a crime scene investigator, I'll see it tomorrow or the next day.
No, it could, because like any other type of evidence, you need to secure it.
Immediately?
You need to secure it immediately, because you need to make sure as fast as you can that just like any other evidence, that nothing's going to happen to it. And then you also need to see it as soon as you can, because that can affect how you process a crime scene, what evidence you're collecting, because you may see things on the video and realize, oh wait, that's involved, or I need to look at this item, I need to look at this location, I need to do things because you just saw it on the video. And so it was not uncommon for me, even in smaller things. I'd go to a burglary scene or go to a robbery scene and see that they have a surveillance video, and I'd ask them, can I see that video? Because if you had, say, an armed robbery, it was an excellent tool for me as a crime scene investigator to watch it happen on the video, so I could say, okay, well, the person went over here and touched this, and they went over here and touched that, and now I know areas to process, and I know what kind of things to do.
And so, tell me, what if the company says, you're not getting it?
Well, the first thing is secure it, because you don't want them to be able to do anything with it. And then go get a search warrant. And then once you have a search warrant, they can tell you you're not getting it all day long, but they don't have a choice. That's signed by a judge. It's an order for you to go get the evidence. And so that would be the step that you would take. You would not let that just go and then rely on somebody else to provide it, because you don't know what they're going to give you and what's been contaminated in the process.
So law enforcement controls the process of securing it?
Absolutely. Once you're there at the scene, then you take control of all of it.
Would you allow an entity just to kind of help you out to preserve it?
You wouldn't. I mean, obviously there's going to be probably some level of assistance, even if it's just, can you show me where the DVRs are? Have them take you to the room, those kind of things. But you're not going to let them take care of it and just trust that they'll provide you with the video. Not just because of a fear that they may do something to it and contaminate it, or that they may not cooperate with you, but more than that is that you don't know what level of training they have in handling that type of evidence as a forensic matter, and they may do something inadvertently to contaminate that evidence that you now have to deal with. And so, that could be problematic. You need to secure that as fast as you can.
Do these departments, for example, the Pasco Sheriff's Office, do they have cybercrime units that are competent individuals in order to properly preserve video evidence?
Most reasonable sized law enforcement agencies have at least somebody within their, usually in their detective unit or technical support unit, that's able to do that. And if the agency itself doesn't, Florida Department of Law Enforcement does, and it's just a phone call away.
What about seating? Not only the seat that the accused person was sitting in, but seating in general. Is that an important factor to consider?
Yes. Whenever you have a case like this where a person is seated and they're dealing with a person who's on another seat in front of them, you have introduced, as I was describing before, constraints. You have stuff in the way between the two people, and also obviously things change. Perspective changes. All sorts of things change based on I'm sitting down as opposed to standing up.
So what do you do with those seats? Do you measure them?
Yes.
Do you examine them to see what type of seat it is, whether it's a very deep cushion or firm?
Yes.
Do you measure the distance between the seats?
Yes.
Do you measure the height of the seat?
Yes.
Do you measure the height of the back of the seat?
Yes.
Do you measure diagonally as well, if need be?
If need be, yes.
And while you're doing those measurements, what do you do in order to memorialize what you're doing?
Well, you can do several different ways to keep track of that. You could draw sketches or diagrams and diagram and show all the different measurements that you've collected. You can photograph them. You can put a measuring device down and then take pictures of each measurement to be able to show it. So there's several different ways you could do that.
And the reason that you're preserving all those measurements is for what reason?
Well, primarily because from a standpoint of reconstructing, you need to have the measurements of the area so that you know what kind of distances you're talking about. But also, in the initial portions of it, you're just documenting everything to have it documented so that you know the locations, distances, and all those sorts of things, because a question may come up later on during an investigation, and you don't want to have to go back and try to get those measurements.
Mr. Escobar,
Yes, Your Honor.
we need to take a lunch break.
Okay.
So, ladies and gentlemen, we're going to take an hour for lunch. If you would be back at 2 o'clock at the jury pool room. Please remember my instructions during the recess. Don't do any independent research. Don't talk about the facts of the case amongst yourselves or with anyone else. Don't watch any news. Thank you. Enjoy your lunch.
I'll ask for the recess in 1 hour.